we have quorum? We good? All right. Then I will call this meeting of the First Five Commission to order at 12:31.
Dave Gordon.
Here.
Beth Hassett.
Here.
Terrence Jones.
Here.
Olivia Kassiri. Paul Lake. Scott Moak. Donna Snaringer. Steve Wertz.
Here.
Lee Turner Johnson.
Here.
Kathy Kosick.
Here.
Terry Porter.
Here.
Christina Elliott.
Here.
Patrick Kennedy.
Here.
Phil Cerna. Chair Cerna is not in today for this meeting, so Vice Chair Hassett will be presiding over this meeting. Commissioner Kennedy will be voting in Chair Cerna's absence. Commissioner Elliott will be voting in Commissioner Moak's absence, and Commissioner Porter will be voting in Commissioner Lake's absence, and Olivia Kassiri is not here, so Kathy Kosick will be voting in her position. This meeting of the First Five Sacramento Commission is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T UVerse cable systems. This meeting is closed captioned and webcast at www.sacmetrocable.tv. Today's meeting will be repeated Wednesday, June 7th at 2 p.m. on Channel 14. Members of the audience wishing to address the board may sign a request to speak form at the kiosk located in the back of the room. Be sure to include the item number you wish to address and give to me. Please speak into the microphone when addressing the board and state your name for the record. If you have any electronic devices, please put them on silent or turn off now. Thank you.
All right, Commissioner Wertz, would you please lead us in the Pledge of Allegiance?
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Item number 1.
Approve the May 1st, 2017 draft action summary.
Do I have a motion for approval?
So moved.
All in favor?
Dave Gordon.
Aye.
Beth Hassett.
Aye.
Terrence Jones.
Aye.
Kathy Kosick.
Aye.
Terry Porter.
Aye.
Christina Elliott.
Aye.
Patrick Kennedy.
Aye.
Motion passed.
Item 2.
public comment on non-agenda items?
I do not have any speaker slips for this item. All right, item 3.
Executive Director's Report.
Good afternoon, Commissioners. Nice to see you all. I'll just cover a couple topics because I think we have lots of people wanting to speak in a long agenda today. First Five Sacramento and the First Five Association participated in the Early Learning Advocacy Day at the Capitol last month. Commissioner Sneeringer was actually a keynote speaker at the advocacy on the advocacy committee, and then we sent our staff around to visit all of our elected officials at the Capitol and talk to them about putting kids first in the 2018 budget. Also last week, Mutual Assistance Network had an open house where they hosted a site visit for community members, residents of Del Paso Heights, elected officials, and it was a pretty wonderful event. We had several commissioners in attendance. Thank you, Commissioner Turner Johnson, Commissioner Cossack, and Chair Cerna were all there. The end of the day, we learned a lot about what Mutual Assistance Network has done to sort of leverage the funding from First Five to be able to sustain their programs and to build programming to serve 6 to 17-year-olds and really the entire family. It was a wonderful day. Wanted to say a quick word about baby boxes. Many of you have probably heard about the baby boxes that are being distributed across the nation, really, and in certain cities. They're starting to slowly make their way to Sacramento, and we have been in discussion with the folks who would like to distribute the boxes in Sacramento. Each is a cardboard box, and each box typically has some baby items in it. At this point, we're not participating in the distribution. I just wanted to let you all know that. The boxes haven't yet to be approved by the American Academy of Pediatrics, and so until that happens, we're excited to be able to have another opportunity to talk about safe sleep, and that's really what the boxes have allowed us to do, which is have further conversations about safe sleep in the community. But we will continue to distribute the pack and plays and to continue on with our own Safe Baby Sleep campaign. And two things not on my ED report. One is that all of our staff are going to be doing a full day training on June 12th to become a trauma-informed agency. So really looking at how we can take that information. We first have to educate ourselves about what it means to be trauma-informed and agency policies and things that we can put in place, and then some trainings that we can roll out to our providers and others to try to get that message more widespread in the county. And at the last commission meeting, we had a presentation from the Birth and Beyond program on their evaluation findings for fiscal year 15-16. There were several questions asked from commissioners back about the data and the analysis of the data. And CAPC is working on an addendum. They should have that done pretty quickly, and then we'll provide that to all of you as soon as we have it, so you can have all the sort of responses to those questions all in one place. And then if you have any further questions, we can take it from there. But they are working on, there were about 7 or 8 different things that you all asked for, and so they're diligently working on that and want to provide it to you all at one time rather than sort of piecemealing it back to you. And finally, some outreach event that was pretty cool last week in partnership with Moms Rising, which is a national parent advocacy group. First Five Sacramento participated in an event called Let's Get Movin' for Kids on June 1st, and that was held on the lawn of the state capitol. It was a family-friendly dance party to talk about moving the budget in the right direction for children. Special thanks to Chair Cerna. He was there participating along with Senator Pan, and then our partners at Children Now and Common Sense Kids Action. So lots going on there, and I'm happy to answer any questions about anything else in the Executive Director's report.
All right, Commissioner Wirtz.
Just a quick question. I'm really pleased to see the training for the trauma-informed practices. And one, I understood you to say that it was for staff, at this point for staff only, and then you would consider whether there was ways to expand the outreach of those concepts and practices?
That's exactly true. Our advisory committee members also wanted to participate right up front, but we kind of just said, I think we need to get on board and sort of figure out what we need to do internally, and then we'll roll it out. The advisory committee also wanted commissioners to receive a brief training on trauma-informed care, so we'll figure out the best way to do that as well. I know some of you already know a great deal about that, others might not, and so more to come, but we are slowly but surely talking that language and trying to get our providers on board.
And just as a follow-up, who's doing the training for you, or how are you doing that training?
It is a group out of the Bay Area, 2 women from 2 different organizations that have funding to work with school districts and county agencies to talk about that sort of larger level systemic change to make those big agencies more trauma-informed. And they're doing it for free because they have a grant, so we're taking advantage of that.
Is it connected to Trauma Transformed or separate from that?
I am unsure, but I can find out for you.
Not a problem. I'm really pleased with that, and I think what I really think is really critical around trauma-informed practices is that often it's just thinking about the workforce. And what I'm hearing you say and what we think is really critical from the Department of Public Health is that it look at the whole systemic situation, not only the organizational structure and policies and practices, but then how those integrate across systems. And one of the examples of that is how referrals. We've talked a lot about referrals and how those are carried out. That often you may, inadvertently cause ongoing stresses to families when you say, we can't handle that, just go work with our partners over there, and the referral breaks down. So the systemic part of that, as well as the organizational policies and practices, are really I'm pleased to hear you pursuing it. Thank you very much.
Thank you.
Any other comments? Kathy? Commissioner Kosick? Oh, wait, there.
I noticed that we are doing the Sugar Bites campaign again.
Yes.
I was wondering if we have any data that shows the effectiveness of that campaign nationally or even just through Contra Costa.
Good question. I don't have it off the top of my head, but I can certainly provide it back to you.
Okay, thank you.
I will return that in an upcoming executive director's report.
Thank you.
Any other questions or comments? All right. Item 4.
Okay, I just want to go, before we go to the
Yes.
next item, Commissioner Kasiri is here, so Commissioner Kosick won't have to be voting in her place.
Okay, thank you.
Item 4, public hearing, approval of First 5 Sacramento 2018-2021 strategic plan.
Great. So staff are recommending adoption of the Commission's 2018 strategic plan. And the plan, as you know, symbolizes First 5 Sacramento's commitment to children and families over the next 3 years. It includes our vision, mission, funding principles, strategic plan hierarchy, indicators, potential strategies, and a spending plan, all of which you have reviewed a couple of times, and it has also gone to the Board of Supervisors for review. The plan before you today has changed in only one way from the version you reviewed in March, and that is within the spending plan. So while the bottom line allocation for the spending plan remains the same, which is $60.1 million over 3 years, we made a slight adjustment in a couple of the categories. So the line item category for program was increased a little bit, and the category of administration was decreased a little bit. And that was made possible. Staff really went through our internal operating budget with a fine-tooth comb. We looked at things that we thought we could do without, and we really saw the need to make sure that the majority, as much as possible as our funding was going into programs, so that we could do both the implementation plan and the system sustainability plan. So it was very slight dollar amount change, but just a little bit increase in program, a little bit decrease in admin. And with that, we're very confident that we'll be able to get the work done internally that we need to. So the full plan is in your packet, and since I did a lengthy PowerPoint presentation on it last time, I didn't think I would do that again, but I'm happy to answer any questions. And just as a reminder before I do that, that in August you will have 2 implementation plans coming forward. One of them I'm calling the program implementation plan, and that is how our funding will be divvied up and used amongst our different result areas. It will have whether or not we're going out for a competitive bid process or a non-competitive application process. It'll have dollar amounts by result area and all of that information in it. And then the other strategic or the other implementation plan is more around our systems change and sustainability. That will also have dollar amounts and information laid out for you around those policy, advocacy, sustainability, and systems change areas. So that's where the real detail is. And again, we're sort of still at the strategic plan level, which is more of a 30,000-foot level.
So I'll take questions or comments from commissioners first, then I have a number of people who would like to speak on this topic. Anyone? Commissioner Elliott.
Just a few things. Thank you for this, and thank you for all the hard work that staff has put into this. I had a question, since you mentioned that you took a good look at your operations. Where have you found a space to put that, whether how large or small it is, the extra money from admin to program? Have you found that where that's going to go in the line item budget yet?
Not really specifically. Okay. We are sort of cutting out some, like, we won't have as big of a kit for new parents, customization and things like that. So we just kind of took piece by piece and said, what can we move? Okay. And right now we're working on the actual budget of the implementation plan, okay, and where we'll find a home for all of that. Yes.
Thank you. And just to add to what you mentioned about the sustainability plan that we're going to start working on in the sustainability committee, I think that it needs to be said that the result areas that are seeing a decrease are not being forgotten, and I think that the focus in sustainability will be how can we be innovative and creative in trying to provide these services to people, maybe whether it's through us or a partnership. But I did want to note that for result area 2, increasing prevalence and duration of breastfeeding, it's my belief that results 7 through 10 directly benefit from increased breastfeeding. And so I think that along with that and other result areas, we can really start to tackle that in sustainability. And I didn't want to, since I'm voting today, which isn't typical, Scott's out, I did want to make note that that is something that I think that everyone in the Sustainability Committee values and is going to work really hard towards. So I support this. I'm not recommending any changes, but I just wanted to make note of that. So thank you for allowing me that opportunity, Beth.
Thank you. Any other commissioner comments? If not, we will go to the public comments. Reminder, introduce yourself when you come up to speak, please, and try to limit your comments to 3 minutes. First person I have is Ebony White Douglas, followed by David Baker.
So good afternoon. My name is Ebony White Douglas. I'm the program manager for the Crisis Nursery. I had hoped that Rain would have gone first, but I will pick up kind of where she's going to start. So we have a number of parents in Sacramento County that are not able to receive services at the Crisis Nursery. The Crisis Nursery has been challenged to serve families effectively and safely given our current budget. And seeing the potential for further cuts will make operations exceedingly difficult. Currently, our $1.8 million budget affords us the privilege to serve upwards of 3,400 children each year. Serving those children takes a great deal of coordination and qualified staff. Maintaining competitive wages in the job market has been the biggest obstacle that we face. While First Five has generously covered $1.4 million of our annual budget, we are still restrained by paying the majority of our workers minimum wage. And this makes it extremely difficult to maintain adequate and qualified staff. To give you more of a realistic portrait of how staffing has impacted the program, I'd like to describe what each nursery looks like during our busiest hours. Do keep in mind that we are a 24-hour program. We have 2 locations in Sacramento, and between 7 a.m. and 7 p.m., we operate services for emergency childcare. In order to operate at full capacity for each nursery site, we need a total of 9 staff members between both sites. Since September of 2016, our reality has been that we're operating with a total of 5 staff members at each site. This still allows us to meet community care licensing childcare ratios, but this does mean that when we don't have enough staff to provide coverage, we have to cap the number of children. We've tried various avenues in using volunteers to provide additional staff support, and we're extremely grateful to the volunteers that we do have. But we haven't been able to consistently find coverage to support the nursery at full capacity. I stand here today very humbled to report that due to the impacts of staffing, we're forced to decline services to nearly 1,000 children each year, and this is a 60% increase from the last fiscal year. Declining services to children is always the last resort. Our case managers work tirelessly to prevent that from happening, but they first base decisions on the number of available staff. Then they examine everything from parental distress, the reason for care, the tone in a parent's voice, or additional statements they make. They help parents identify natural resources like friends and family that can assist. They provide referrals and resources, and they always give the parent the option to remain on the wait list until space becomes available. The Crisis Nursery program is the only kind in this county, and for the last 21 years, we've been keeping children safe and providing assistance and truly strengthening the entire family. Compared to the county alternative, the Crisis Nursery is truly a cost savings program. I urge you to carefully examine all the information presented when making decisions about our funding and provide us the ability to serve families safely and effectively.
Thank you. Yes, Commissioner Gordon.
Could you share with us how your program is funded in totality? In other words, how much of it is provided by First Five compared to other sources, and what are those other sources? And for me, anyway, that would be helpful if other speakers who are speaking along the same lines could do the same thing.
Yeah, absolutely. So like I said, our operating budget is 1.8. First Five gives us approximately 1.4 million. So the rest is about a $350,000 to $400,000 deficit. And we get the additional funding from other philanthropic efforts. We have several grants that we also get, and I do believe another speaker will elaborate on that more.
So in other words, the rest of your money that doesn't come from First Five, none of it comes from other government sources?
Correct.
Correct. Thank you.
Thank you.
Thank you.
Then was Rain McKenzie going to talk about the same topic? Yes, should we? We'll call you up. And then David Baker.
Hello, my name is Rain McKenzie, and I'm not only a current member of the Sacramento Children's Home Board of Directors, but also a former client of the Crisis Nursery. I recognize there's not enough time to tell my whole story, but I did want to convey how important the Crisis Nursery has been in my life and what a critical role it played in helping my daughter's father and I succeed as parents when we had nowhere else to turn. My daughter Lyric was the result of an unexpected pregnancy, which immediately presented stressful challenges to us parents who weren't financially or emotionally prepared. Additionally, we were very isolated without the support of close friends and family. And then I was also diagnosed with postpartum depression, which left me overwhelmed at the prospect of caring for a newborn. Luckily, not only my nurse, but my neighbor saw my struggle and both wholeheartedly recommended the crisis nursery. At first, I felt like it was admitting defeat to reach out for help, but when Lyric was 7 weeks old, I hit my breaking point and I was desperate for help. When I walked up those steps, I'm not sure who was crying louder, her or me. The caring staff, though, welcomed us in and sensed immediately that we were both in need of support and some TLC. After being reassured that she would be cared for in a safe, loving environment, the focus was put on me and how they can best support me as a mother. I was assigned a case manager who ensured that I had the respite care that I needed and followed it not only with me, but with her father as well, who was also coming to terms with the birth of our daughter and in need of tools and resources to cope. Through the years, the nursery was there to support me through hard times, whether I was receiving outpatient treatment for my mental health, or if the climate at home was a bit hostile as her father and I dealt with our own crisis, like his job loss, me struggling to finish college, and our continued adjustment to parenthood. We were so grateful to have a safe haven to turn to that provided not only safe and loving care for our child, but that helped decrease the parental stress and provided confidence. They also provided confidence-building activities which helped me to become more secure as a mother. Her dad and I were also directed to other community resources that offered mommy groups, counseling, and parent classes. And the nursery even provided extra toys and clothing that was so appreciated during those early years when we were in financial need. Fast forward 6 years, and I'm happy to say that we both recovered financially, mended our relationship, but most importantly, we are the proud parents of a happy, healthy 6-year-old who has fond memories of fun times at the crisis nursery and still talks about the caring staff. Sadly, though, I have a good friend, a single mother, who recently was facing her own mental health crisis and was in desperate need of the nursery for her 2 boys so she can receive medical help. Unfortunately, she was turned away not once but 3 times, as neither nursery had the staff to accommodate her, and it was heartbreaking to see her in distress with nowhere else to go. So my fervent hope and plea is that funding will be available to keep the doors open and fully staffed, to provide the help and encouragement needed to support parents and children through difficult times. They say it takes a village, and the crisis nursery was an integral part of my village. Please keep this lifeline available so that my happy ending can be the happy ending of countless others in our community. Thank you.
Thank you. All right, David Baker and then Sean Flanagan.
Okay, thank you. Good afternoon, Commissioners, and thank you for this opportunity to speak with you today. I'm Dr. David Baker. I'm the Chief Operating Officer of the Sacramento Children's Home. And as you consider the 2018-2021 First 5 Strategic Plan, I want to take an opportunity to share with you some important information regarding the crisis nurseries, which you've been hearing about. The crisis nurseries provide a vital support for families during times of crisis when there's no one else to turn to, providing voluntary, confidential, free emergency child care for children aged 0 to 5 for 24 hours a day, 7 days a week, 365 days a year. We also provide case management supported services and other vital support services for families that dealing with crisis. It's a vital early intervention program providing safety for families in need. When families are in crisis and lack support system, their risk of abuse and neglect rises. This is especially true for the most vulnerable children, the younger children. In Sacramento County, it was approximately 3,000 children were placed in foster care in 2014, with half of those being 5 and under, and almost 97% of those being victims of abuse and neglect. The crisis nurseries are a vital resource for the Sacramento County that can prevent children from entering the system, preserve families, and save money in the process. So I thank you for your time and ongoing support of the crisis nurseries. Thank you.
Thank you. Sean Flanagan, and then we'll hear from Todd Kulakian.
Hello and good afternoon, Commissioners. My name is Sean Flanagan. I am a volunteer at the Sacramento Crisis Nursery, and I'm a former staffer at the Capitol building, and so going through budget items is nothing new for me, but I just want to encourage, as you guys go through your budget next year and as revenues are declining, I think it's real important to take a look at this program because it's done so much for the Sacramento community. And as a volunteer and seeing the families that get there, seeing the children that get help is really, really important. When someone comes to the crisis nursery, it's usually one of the darkest days of their life, and showing up to a loving environment with helpful staff is critical. And so, as you heard from the previous speakers, how important this is to them, and that's why I'm here today to say how important it is to me as well. So I encourage you folks, as you go through your budgets, even go tour one of the crisis nurseries is really helpful as you kind of consider some of these budget items about programs that are necessary and some programs are not. And so I think this program stands out more than others, and obviously you want to give money to everyone you can, and I understand that, but I think from my experience and the lens that I look through and all the different programs that I get to work with from a staffer standpoint, working in the Capitol building, this is one of the ones that stood out to me, and that's why I commit my time to help them out. So anyways, I thank you for your time today and appreciate your consideration going forward. Thanks.
Thank you. Todd Kulakian, followed by Lisa Yarbrough.
Good afternoon, Commissioners, and thank you for the opportunity to speak this afternoon about the Crisis Nursery Program. My name's Todd, and I'm the Director of Philanthropy at the Children's Home, and I just want to kind of speak a little bit more on what Ebony was discussing and what Rain was discussing earlier, and that is just our capacity financially and the use of volunteers and additional financial resources to support the ongoing operations of the nursery. As our Director of Philanthropy, I oversee our fundraising efforts and our volunteer program, so both of those are integral to the nursery. The nursery consumes the largest amount of our fundraising dollars each year to help fill our budgetary gap. We've shown great success in being able to address the ongoing sustainability by bringing in volunteers and also raising money to offset whatever budgetary gaps we have. But as those rise and as we need more and more to support the nurseries, as you've heard earlier, we've had issues with being able to staff the nurseries and fully operate at full capacity. So I appreciate the opportunities to speak. I hope that you'll continue to generously support the nurseries and that it will be a central part of your budget and ongoing strategic plan. Thank you.
Thank you. Lisa Yarbrough, and then Stephen Marmaduke.
Good afternoon. I'm Lisa Yarbrough. I'm a board member at the Sacramento Children's Home, and I just wanted to point out that the Crisis Nursery Program is a cost-saving program. It provides free daycare, family strengthening services, with the ultimate goal of keeping kids out of the foster care system. Intensive care for a residential program that provides mental health and other services is far more costly, and that often is offered after abuse and neglect has already taken place, whereas the Crisis Nursery spares children from trauma and really works hard to prevent that abuse and neglect. So as a community member, as a mother, as a board member, I urge you, as you look at implementation and funding for the strategic plan going forward, that you maintain full funding for the Crisis Nurseries. As you've heard, we can't maintain our current operations with our current level of funding, and funding cuts will even hamper our ability to serve our community going forward. Thank you.
Thank you. Stephen Marmaduke.
That's Stephen Marmaduke. Thank you for the opportunity today. My day job, I'm managing partner of the Wilkie Fleury firm, but my passion is being president of the Sacramento Children's Home. And what I wanted to do is assure you the commitment of the board and the greater Sacramento Children's Home community to this program. We're very committed. I think you folks all appreciate the value that it provides, and we appreciate your partnership. I want you to know that we're committed to the sustainability of this program, and the shortfall between what you can give us and what is needed to make this program is made up in hard work, passion, and generosity of our community, and we're very fortunate to have that. Just a concept I want you to think about is, are these really crisis nurseries or are they opportunity centers? For the families, they're crisis nurseries. For those of us who are trying to improve our children, our family, and trying to interfere and interrupt child abuse, they're opportunity centers. If you subscribe to the notion that early action and education are foremost in breaking the cycle of child abuse, these are opportunities. We have parents coming to us because they're reaching out because they need help and they want help. And we're in a position to provide them help, and we've proven to be successful. Yet we're turning 1,000 kids away a year. So these are opportunity centers that we are not fulfilling, and I hope we have your continued support in doing that, and we'll continue to work with you as a valued partner. Thank you very much.
Thank you. And finally, Maria Sperber.
Good afternoon. I'm Maria Sperber. I am the president of the Friends of the Crisis Nursery, and the Friends of the Crisis Nursery is an auxiliary board of the Sacramento Children's Home, and our main function is the financial viability of the Crisis Nursery program. We are the alternative to government funding. As a matter of fact, today we are hosting a golf tournament right now to raise money for the Crisis Nursery program, and I just want to assure you that the Friends have been committed to this program for 20 years. We will continue to be committed to this program going forward, and this is my personal passion. I can tell you from my childhood, my mom could have used the Crisis Nursery a handful of times, and that was not available to us, and luckily we had some families step in and help me. So, we work tirelessly with Todd and his team to fund this program, and I really urge your support as you look forward. Thank you very much.
Thank you. Commissioner Gordon?
Thank you. Could I just ask staff, as we move forward with all of the budget recommendations yet to come, to check on other counties and find out how similar programs to the Crisis Nursery here are funded in other counties? That is, are they all funded by First Five and nothing else, or are there other sources, particularly of government funding for such programs, so we could evaluate some of the options? Thank you.
Commissioner Wirtz.
Thank you. Just a general comment from the Evaluation Committee I chair, that we've been working on our results-based documentation to help programs figure out how best to both do the sustainability and to work with us on documenting effectiveness. And I wanted to say that we were looking at, among all of our programs, the Crisis Nursery, the last time we met, and we're looking for how better to document the outcomes. For example, we know that a lot of the families need to come back, and they are served more than once in the Crisis Nursery, and we think that that's likely to be due to the fact that they continue to experience some kinds of stresses and value and benefit from that value. So I just want to urge the board and staff to be looking for ways that we can help you with what kinds of things that we could be measuring that would better demonstrate the value to both to your other funders and to us as well. And I do want to say, just to put this in context, that as many of you, or some of you in the audience will know, that I worked with Sue Bach in the early days to help create the context for setting up the Crisis Nursery, and have valued it for the many years that it has existed. And I think it continues to serve an incredibly valuable function. But I would urge us all to work together to look for ways to document those effectiveness and cost savings and value added. We may need, I know you have some intake and exit forms for families that show sort of how they perceive the value, but I think we need to look at kinds of ways that that we actually do avoid foster care or avoid other outcomes. And I just want to say that I think as part of the evaluation committee that we are on board with trying to find ways to support that kind of documentation as we go forward. So,
Commissioner Elliott.
In my first statement, I mentioned Result Area 2, which was increasing the levels of breastfeeding, but I want to reiterate that the Sustainability Committee is looking at all of the programs that are experiencing a decrease in funding, and we are working really hard to try to figure out alternatives to that. And that will be in coordination with those programs as well, I hope. So that communication should be ongoing. We meet, I don't know the next time we meet, but I would encourage all of the groups that might want to provide us feedback during the sustainability process as we start to look at some of these alternatives, come and participate with us and partner with us in examining alternatives to some of these crises that we're all experiencing in this room. Our funding is decreasing as well, which is why we're all here talking about this. So, but I appreciate everyone in the audience being here, and your comments are not falling on ears that don't want to listen. We certainly are here together, and I hope that we can find a path forward.
Any other comments or questions? We do need to vote on this item.
Mm-hmm. Dave Gordon?
Oh, we need a motion?
Oh, sorry.
I move to approve the strategic plan as outlined.
I'll second.
All right.
Dave Gordon?
Aye.
Beth Hassett?
Aye.
Terrence Jones?
Aye.
Olivia Kassiri?
Aye.
Terry Porter?
Aye.
Christina Elliott? Patrick Kennedy?
Aye.
Motion passed.
Right. Item 5.
Approval of Third Amendment to the contract with Golden State Water Company.
Okay. Julie Byers is going to take the lead on this item for the commission.
Good afternoon, Commissioners. So item 5 is our Third Amendment to the Golden State Water Company contract. We do have 2 representatives from Golden State here if we do have any questions. Don White, Water Quality Manager, and Brian Rinn, the Associate Water Quality Engineer. We've been to you, as you know from the commission letter, we've been to you several times with this contract. Initially, the contract is to provide fluoridation to their 2 program areas, 2 service areas, the Cordova service area and the Arden service area. In this process, we asked them to provide a study which outlined what the service area would do, what the facilities would be at each of their locations. And from that study is how we developed the initial contract for fluoridating these areas. You can see in the background that fluoridation has been a priority for the Commission over the last 14 years. And we have had great success in conjunction with what we have done, and also the fact that the City of Sacramento is a fluoridated water district, to be able to reach a very high percentage of our population. In this case, over 800,000 residents, more than 78,000 children, 0 to 5, and so about 65% of the children in the county, 0 to 5, are receiving fluoridated water. Which is way up from 20-30%, I think, when we started. So it's been a very impressive effort over the years. So back to this this effort with Golden State Water. So we came to you in December of 2014 to do the initial contract. So the statistics for both of those service areas are there in your commission letter. The Cordova service area being the largest area, and the Arden service area being the smaller of the 2 projects, with approximately 44,000 connections and 14,000 connections respectively, and then also data there on the number of children that will be being served. In proceeding forward, when we asked for the original water program study and what that would involve in terms of facilities, the facility for the concept of the American River Pipeline was not yet a facility. It was a known idea, but there wasn't a facility, so there was no way for them to be able to actually give us an estimate for the cost for that project. So in February of 2016, we had come to you, explain this, and we did an amendment to the contract to be able to do that feasibility study to figure out what would need to be happening next. That study was presented to us in October of 2016. The process of dealing with all the information that came from that study took us beyond the December 2016 end date from the original contract. And so the second amendment, which is done under Director's authority, was to just extend that contract to June 30th of 2017. So the Golden State Water study for the American River Pipeline project basically came up with the three options that are listed there in the middle of page 2. And there was, that the next little paragraph, as short as it is, an extensive review and discussion of the options occurred, is really hugely condensed from what happened. There were, multiple meetings with various parties involved, and all kinds of different scenarios were developed and looked at. And so this becomes the recommendation to go forward with the Arden program. It's a compromise. It really is, because of looking at all the different options that were out there. I'm more than happy to talk about those further if you wish. So the recommendation is to go forward with just fluoridating the Arden system. It's a smaller system. It's closely spaced single homes. There's also a Head Start program school there in that area, and that area is surrounded by fluoridated water districts. So this, because of our strategic plan, the financing, this project is right now the last planned fluoridation project. Going forward, the overall project gave us, and then reducing it to just the Arden project does, in effect, put back money, make money available to go back into the general fund. And Golden State has repeatedly said they're willing to do whatever the commission wants to do. They would love to go forward with both projects. But with this compromise, they are certainly willing to go forward with just the Arden project. So the fiscal impact is at the top of page 3 in your report. We would reduce the contract value to $1,018,785,857. That's a mouthful of funds from the 3.8+ million from the original contract. So that puts about $2 million back into the general fund. Now, and the other thing is that this is a cost reimbursement contract. So with capital projects, for those of you who have been here a long time, capital projects can have cost increases. So in looking at this compromise, what we tried to do is make sure we had that covered, and to make sure we had money in the budget to be able to cover increase in whatever increase there happens to be. And it's a cost reimbursement contract, so the total expenditures may not be the entire $1.8 million, but we wanted to make sure we were covering the possibility, since we did start this project quite a while back. So and so in this case, Golden State will be billing us as their costs are incurred. This is only construction, and the costs go with construction, project management, permits, all those different kinds of things. The actual operations and maintenance and contract will be held and fully funded by Golden State Water. And part of participating is a 20-year commitment. So they have committed in writing, and their board has submitted documentation to First Five, as is standard for all of our fluoridation projects, that they will continue to fluoridate for 20 years. So our staff recommendation is to to permit the executive director to negotiate and execute a third amendment to the agreement with Golden State Water in the amount, if I can pronounce it again, $1,817,857 for the fluoridation project to only fluoridate the Arden area.
All right, any comments? Commissioner Jones.
Thank you very much. And Commissioners, I'm very grateful for this Commission's past funding for fluoridation efforts throughout our community. And I think our efforts have brought the benefits of water fluoridation to a lot of very needy communities and provided a great enhancement to the overall health. And I appreciate the sensible recommendations that staff has presented for our consideration today. I appreciate the open and transparent way in which staff have encouraged, listened, and acted upon my own input. I am also very comfortable with the recommendation that staff provides it. I will support it. I think it's doable, and I think we can complete it in an expedited manner. However, given that this is the last fluoridation project that this commission will ever fund, I'm a little unsettled by the fact that we're choosing the one with the fewest children. And I think, consequently, I would like to request that at least we have this commission consider or have a discussion regarding the merits of the Rancho Cordova project, and I'm prepared to lead that at least. So I appreciate the difficulties that the Rancho Cordova site poses. It is much more expensive, and there's various estimates for that. It would require more county staff time, from my understanding from county staff, but it would also incur a lot more First Five staff time. The other fact is that the facility would need to be located in a parkway. That's a critical aspect. There were three, as Julie alluded to, there were three sites chosen for speculation. Only two were considered. One is if we were to actually fluoridate at the Carmichael water supply side prior to the water going under the river and coming up to the Cordova side. Carmichael Water District absolutely refused that. So that was never an option. Buying a house and trying to, make that work never was considered seriously. So it was always, the focus was on one thing, the parkway site. In addition to being in a parkway, it's also in a floodplain. So it's combined even more problems. And I think finally, the parkway site would encumber all kinds of political capital on the part of our supervisors and a part of our staff and a part of many of them. And even worse, it may not get approved after all the work we do. However, I think the Rancho site still would serve nearly 11 times more children and nearly nine times the total residents that the Arden Park site serves. The Rancho facility would be more cost-effective project than the Rancho, or the Arden one. If you divide what our estimates are roughly into, the latest one for the Rancho only would be $3.1 million, based on Julie B's estimate. If you divide that by the $44,677, that's roughly $70.86 per person on an annualized basis. If you compare that to the 1,817 people served in the Arden site, it comes to about $350 annualized per person. If you factor in the benefit that this is a guaranteed contract, a contract signed by our water district, that they will guarantee 20 years not necessarily stop at 20 years, but just guarantee in contract, in writing, that it will be 20 years of service, that cost goes down to roughly about $3.54 for the residents of Rancho and roughly about $23.01 for the Arden. Still great savings, incredible one. So again, I think that's it starts and finishes right there. You're serving more people. They'll receive it for 20 years, and that cost-benefit structure still is very important. And I think you want to look at it, too, is this is a public and a private joint venture. That's unusual in what we do in our commission and on some of our strategies. We take public money and we combine it with private guarantees with their money to do this kind of national, international health benefit. And I think you have to look, I would say that fluoridation investments should be viewed in the light of 25 years of managed care dental neglect. And I think an abandonment of our children, where nearly 60% of those who are on the managed care system, have not actually seen a dentist. And they continue not to see a dentist for the past 3 years. In our latest estimation, we show that that's still a trend. Department of Healthcare Service shows us even from 2014, 2015, and 2016 rates. Given that neglect has endured for 25 years, then I think providing water fluoridation to 45,000 residents that in a low-income district versus the 5,000 also makes a great deal of sense. And I think with regard to the DTI, because we've talked about the DTI, well, they've given us $3 million, $10 million over 3 years, roughly $3+ million of investment. Isn't that enough? Are we still asking for more investment for oral health? I think partly, one way of looking at it is that we received this enhanced oral health because there was a recognition that we have an outstanding track record at First Five Sacramento with regard to oral health infrastructure funding. And I also think that it was a recognition on part of the state and the feds that we have staff that are capable of delivering on our promises that we have made to families with regard to oral health. But I also think even more that it was a statement that we had a community which had a long way to go to correct the 2 decades of damage done by systemic neglect, and that more investment was needed to get that done. So I think if our federal government recognizes that, our state government recognizes the need for extraordinary investments to help the community, I don't think it's too much to ask this commission to reconsider this recommendation and try one last time to bring about a narrow and a deep investment to the 45,000 residents of Rancho Cordova. Thank you.
Thank you. Commissioner Kasiri.
Just had a couple of questions for clarification. So with this proposed plan, what is the proposed completion date?
Actually, although we've indicated 18 months extension, they're anticipating to be done in between 12 and 14 months.
12 and 14 months.
And probably by 12 months.
And then if we go with this, there's a $2 million amount that would go back to.
Right.
So how is that going to be redistributed? Is that going to be included in the plan that's coming up for vote this year? Or?
I'll defer to Julie.
Probably not. We'll definitely talk to the Financial Planning Committee about it, but my recommendation would probably be to keep the money in our fund balance and use it to help offset our second fiscal cliff, because in 2021, our fiscal cliff is 30%, and the $2 million could go a long way toward keeping programs almost steady, more close to a much less cut in 2021.
And lastly, if for future, if you could include a map, it's a little difficult for some of us to visualize where all the different locations are. And also if the map could include the previous work that has been done and where the fluoridation has occurred already. Thank you.
Commissioner Wirtz.
Thank you. A couple things. I want to appreciate Commissioner Jones's commitment to this and understanding of it, and I certainly defer to his knowledge base for that. But as an early supporter of the Commission and of the fluoridation, I also want to acknowledge and recognize the incredible value from a public health point of view of fluoridation in general. And I too was concerned of the two options here, not knowing the details but not being able to fund the Rancho piece is troubling to me. And so one, I would be willing to work with Commissioner Jones on looking at any other options that might be available to look at this. I looked at it on a simple level here, that the amount of money that is being proposed here for the smaller Arden area would be around 48% of what was originally proposed. I hear Commissioner Jones's calculation that doing the Rancho might be 3.1 million, but just taking the 3.8 million, this amount is 48% of that. And unfortunately, the number of children, I'm focusing not only on I should be focusing on the families, but just looking at the children under 5. The Arden area, this says, would be reaching 600 children, whereas the other one would be reaching, the Rancho area would be reaching something on the order of 7,000. And so that's about 8%. So we're spending 50% of the money we proposed originally to cover only 8% of the children that we originally expected. I obviously have not been involved in the difficult issues of what it really takes to do this, but I am concerned that this does not look like the same kind of investment that we were, one, hoping for, and two, I think our children and families really need. I want to confirm that I have been an advocate of maintaining, of initially putting fluoridation forward as one of the best solutions that we could do for narrow, deep, sustained interventions for our children, given the nature of the dental issues. But I am concerned with regard to this proposal, and would be glad to work with Commissioner Jones if there was some further steps that could be taken to look at this.
Thank you. Julie?
Sure. Well, both Commissioners Wirtz and Jones are so very eloquently articulated my concern with putting this recommendation forward. This is probably the most challenging thing that I've worked on and brought forward to the Commission since I started 20 months ago. It is a compromise, and it was difficult to get to this place, and I only got here after multiple conversations with our county executive and county department heads and our chair and others, because the odds of actually making it happen seem so very remote, and the amount of work that would go into trying to get to that positive seemed substantial. And the biggest challenge, which Dr. Jones clearly stated, is that our real only option is to put it inside the American River Parkway, and probably within the floodplain of the American River Parkway. And between our American River advocates and supporters, environmentalists, and the residents, my initial feedback had been that this probably won't be feasible. And so I agree that going the Arden-only route is probably not the best. It's not exactly what you signed up for, to spend $1.8 million, but I felt like I wanted to be able to bring you something, because I know how much you value community water fluoridation. I really wanted to be able to bring something to you to consider without saying no to either. And so that was my compromise. And I am also very open and willing to continue to work on it. I just don't know to what end or when we would say that's it, or I leave that to the commission. Those are the hard decisions you all have to make. I'm glad I'm not on the other side of this chair. But.
Commissioner Jones.
Thank you, Julie. Thank you, Steve. So let me respond first to the 616 children that is currently proposed for the Arden. You know, I think the benefit of water fluoridation is just that it doesn't exclusively involve access to water that only 616 children can receive. You have to look at it in a larger context. Even though we're funding it for 616 children, the 5,000 families and relatives, in addition to the others within the community who come in and imbibe the water, are going to receive that benefit. And again, this is a public-private partnership. So if we fluoridate Arden, we'll be providing $1.8 million to do so. Golden State will be providing roughly about $120,000 of operation and maintenance annualized over 20 years. That's over $2,400,000 of private funds that will supplement the $1.8 million of public funds that we're doing. If we choose, for example, the Cordova system, it's $3.1 million for the 45,000. I feel like they're out there. This is a lost opportunity cost, I think, and we deserve this conversation. I appreciate it, so I'd like to hear every commissioner speak, at least as an explanation to the 45,000, why we're not choosing them. And I appreciate that, and I think we're having that conversation. But if we do fund Cordova, and I'm trying to give it at the highest amount, and that was by Julie B's latest estimate, which I think was generous in terms of cost, at $3.1 million. That would mean we'd put up $3.1 million to build a facility, and Golden State would provide roughly about $350,000 annually for 20 years. That's close to $7 million for our $3.1 million in investment. That's incredible. I don't see people coming up to us asking to partner and give us that. Now, if they go longer than the 20 years, we have an even more of a return on our investment. Let me just go back maybe just as a factor that why are we doing water fluoridation, because I think most of you are here and most of you have general ideas. One, we know that it prevents tooth decay. You know, fluoride's the most efficient way of preventing it and common in children, but an estimated 5.1 million school hours are lost, 164 million work hours are lost each year because of dental-related disease. This is one of the most important methods of preventing it. And Center for Disease, you've heard this before, says it was one of the top 10 public health achievements. I think it protects people of all ages, and that's why I said just looking narrowly at the children diminishes the virtuous circles of benefits that are provided by water fluoridation. Thirdly, I think it's safe and effective. For over 70 years, you've had all kinds of Center for Disease, American Medical Association, World Health, American Dental, American Academy of Pediatrics, all recommend it. Where money's available, they want it invested in this. I think, again, it saves money. The average lifetime of a person with fluoride is less than the cost of one filling, so that for most cities, $1 invested means $38 in dental treatment costs that are deferred. And I think, again, we all know it's a natural investment. Fluoride exists in our water, whether we add to it and put it in the proper levels to prevent decay, but it's a naturally occurring mineral. I think in my conversations, and I know I appreciate this, taking the time to go through this because I do think it's important. I want to make sure I, in good conscience, have explained it to all of you, and I feel the responsibility of the 45,000 who are looking to us to decide, do we go or not? And in speaking to this, I think that we've looked at the floodplain side. The engineers that we have, the contracted engineer that First Five uses, Lyle Hogue, the engineers from Golden State, have all said that this is a system, if we build the facility, it'd be roughly about the size of a two-car garage. There are larger facilities right now. There are utilities already in the parkway right now. They exist in the parkway near where we want to place this. They're practically at the river level right now, so you see big pipes sticking up with utilities. We have a restroom there. This would be roughly a facility about the size of a two-car garage. It would store a minimum of about a week to 2 weeks worth of fluoridation materials. It's powder. In the event of a flood, generally it's not a catastrophic event within seconds. It's known that river waters were going to be rising. You would have the ability, and I've been assured by the Golden State, that they could remove they could first of all seal the thing, stop it off, and then remove any fluoride that is usually there, maybe a week worth of fluoride, remove it from that site, making it perfectly safe within that floodplain zone. So I don't think they're insurmountable. I think they're a challenge. I think they're a difficulty. It is that. I think it would definitely take Board of Supervisors listening to people talking about the sanctity of our natural parkways. I get it, but I think I certainly think we should roll up our sleeves and fight for it, and do the right thing, and fluoridate the more complicated one. I think it's worth the challenge, but I'm perfectly willing to settle for the Arden if that's not the case, because of all the benefits we talked about.
Thank you. Commissioner Turner-Johnson.
I'll keep my remarks succinct and to the point, understanding that all that's been said is been heard by everyone. I first of all want to appreciate Dr. Jones, because I had no idea of this kind of current detail. But the first thought that came to my mind when I read it and then heard Julie speak was, what's the unmet need? I remember, it's got to be 5 years ago now, when on the advisory committee for First Five, this was very much a priority item related to oral health, and I think the total at that moment that we were looking at was around $5 million. It continued year after year, being a part of our discussion and coming to the commission, of course, because there was so much delay with Golden State and all the entities. It's clearly very complex. It's been complex from the beginning in terms of working out preparation and readiness and costs and the public-private venture. The thing that I think, having listened to all of this now, is that in my mind, what I hear is that the cost effectiveness of serving more children for a slightly higher investment, and a much higher one on the part of Golden State, is worthy. On the other hand, we're not at a great timing right now in First Five with our funding. We all know that. So of course we're more sensitive than ever to those kinds of decisions. But in the end, the thing that I don't know enough about, but I certainly defer to Dr. Jones here, is that with a close assessment of exactly what are the barriers to really making the Rancho Cordova work, given that it's related to all kinds of things, political capital, the investment itself. If we did so, if that was the decision in the end, is it really just going to get stymied somewhere along the line and not end up serving any children? Because that isn't worthy. We know that. And no one, certainly Dr. Jones, would not want that to happen. So I think from my vantage point, I would just say, because I don't know, how clear are we on what those barriers are and what are our chances of getting that through? And I say all of this because my experience experience over the years working with children is that oral health is so difficult to get. And we know from brain research that when there is tooth decay at any kind of significant level over a period of time, it affects cognitive functioning in early childhood in children, and that matters to me. So thank you.
Thank you. Commissioner Elliott?
Kind of already addressed it. I would just like to know, I guess, exactly how positive are we that the Rancho Cordova site is not a viable option, I guess?
Sure, yeah, that's a great question. And it does come down to sort of those three groups. It comes down to environmentalists and just worried about a spill in the parkway. And I think after talking to Lyle Hogue, who's our engineer, I mean, I agree, we're not keeping a year's worth of chemicals there. And I don't think even if fluoride did get into the water, the amount of water versus chemical, it's still not, we're not looking at poisoning thousands of people and fish and things like that. But having done this work in Yolo County and having dealt with environmentalists there, I can certainly assure you that in and of itself is going to be a super hard sell. And then there's the Friends of the Parkway, and even though there are other, as Dr. Jones mentioned, there are other facilities in the Parkway, including restrooms and other things. Having a site the size of 2 to 3 car garage that makes a little bit of noise, not a lot, but a little bit, and has transportation going to it on a weekly basis. Or I think that we will definitely hear from those groups. And we looked at putting it up out of the floodplain. That was our very first look, was to try to get it out of the floodplain and up closer to the neighborhood, because that was actually what the engineers for Golden State Water's first recommended, was put it up out of the flood zone. And to do that, though, we had only 2 options, really. One of them was to buy a home, and that really isn't an option, to buy and tear down a home. The other option was to put it sort of in the backyard-ish area of the current residence, and we did go out and walk that and decided that we would get a lot of complaints from residents to do that. So we were looking for another place to house it, and sort of ran out of time. We were going to ask Golden State Water Company to do another report for us, to give us some specific locations within the parkway. But just in my conversations with our elected officials and our county administrators and folks I've been talking to, it just didn't seem like it was like there was going to be traction to do it, no matter how, because it wasn't necessarily a logical discussion anymore. People were emotional about chemicals, they're emotional about parkways, and they're emotional about their view to nature. And when it becomes not a logical but an emotional thing, then typically we lose.
And I would argue that the fact that utilities are in the parkway already is actually against us. If there weren't any utilities in the parkway, we'd have nothing to compete against, and it would just be that. But there's already utilities. There's already things that environmentalists have been upset about in the past, and this would be adding on top of that. So I agree that that is a huge obstacle, and from a viability perspective, I think that makes sense as a huge obstacle. And I appreciate your point around, if we take on that challenge, do we get to a place where we're stymied and then no one gets any fluoridated water, which would be worst case scenario?
Yeah. And, I haven't sat down and thought through every meeting that we could have and every, I don't have a work plan put in place for what what we could potentially look at over the next 2 to 3 months. I'm not saying I'm not opposed to doing that, but I think it then involves people outside of just ourselves. We're committing others and asking others to begin that work with us, and it's something that we can do. Again, I don't know to what end and to when to say that we've put enough in or not enough, and I absolutely want to please Dr. Jones and all of you, so I look to you for guidance.
Commissioner Jones.
Thank you. And just to that last point is that, I think that I know that we want to get an answer and move forward, and I appreciate that. But I think sometimes perhaps delaying it, I know that that's not the preference, but we're having the conversation only, is that if we did continue with the study that we talked about having, that Golden State would determine the ideal location for this facility, whatever it is, within the Parkway. My understanding from the conversations with Golden State, that would happen and be completed by the end of the year. If in the period of time we did do some of the reconnoitering and discussing with the outside groups, you wouldn't lose $3.8 million. Nothing would be lost. $20,000 for the study, but you'd still have available for this commission to utilize any funds that were not available for any project that you so desire. And so it's not a loss. Even if we decided at that point in time that the Rancho Cordova, say in December 31st, January, we come back and say, it's a no-go. We've done all possible checkpoints and followed through on them. You could still, and I would advocate that you do, fluoridate the Arden Park. So you haven't lost the fluoridation program either. You still have those options. So this is a little bit of a discussion. That's why we're having it here. Do we decide now, or do we do a little more investigation? Again, I think of the 45,000 kids and adults that would be served. Thank you.
Commissioner Wirtz.
Well, I think I was just asking for clarification between, and the proposal on the table is for going for the smaller Arden area my question was, are we comfortable with that estimate of $1.8 million for that work, which is what I was concerned about, is not getting as much coverage as we might have hoped. So that was my first clarification, is that's what's on the table at the moment. But am I understanding, Commissioner Jones, that you're proposing not to act on this until we resolve whether or not it's possible to go for the Rancho Cordova position either instead or together? Am I understanding that right, that the reason why we're not just going to vote on this item up or down for Arden is that we're looking at the option of holding off while we try to find a way to do the Rancho Cordova piece? Am I understanding the question before us?
Well, first of all, yes, I think succinctly, yes, I would like this commission to give us direction, really. And so if that involves a motion to vote it up and down to go forward with this information, I'd like that. My understanding, if I made the motion, somebody here would have to second it. And then we would go ahead and discuss it. And that motion, if I made it, would be that we continue to look at the Rancho Cordova section and that we investigated all aspects of the viability to see if this is a doable item, and then come back and report back to you. And at that point, but I do think that's important. If we make the motion, it's seconded, and you decide no, you're not going to do it, you still, from my understanding, have on the table the Arden Park fluoridation. So we could still have that. My sense of it is, I'd like to get the commissions to weigh in. You know what my opinion is. I want the voting members to say, no, let's not do it. Or yes, let's do it. Because you can see the discussion that staff and I and staff and Golden State have had. These are good, healthy discussions that we personally have had. What do you think now? You've heard the discussion. What do you do? So I'd be comfortable, and so I just want to defer a little bit here with making that motion. I'm going to bring it back to Julie first, though.
Sure.
You mentioned $20,000 for an additional study. Is that because that's what the original feasibility study cost, or this additional would be an additional feasibility study?
Yes,
Julie can answer that.
We asked Golden State Water if they would do an additional feasibility or a location study, really, to show us where within the parkway would be the best place. It's a little under $20,000.
I see.
So what it sounds like maybe you're asking for, Dr. Jones, is extend the contract again for up to 6 months and just have the contract be for $20,000 and then not make a decision on Arden. And I guess it's important because there isn't enough money to do both unless you want to allocate additional money at this point. So even if we could get both of them, then that would be a different decision coming before you.
Well, I would say, thank you, I would say that if we go with Julie B's estimate of 3.1, then I'd extend any discussion for only the 3.1, which means you'd eliminate the 3.8 and you'd have $700,000 available for reserve funding. So that's one. So if that's the estimate, and again, I'll go back to Steve's concern a little bit about the 1.8, and I think is legitimate, is still, remember, a cost basis, contract. So it may be that, or may be less. We're trying to, in all due diligence, the staff has worked very hard to, if anything, maybe overestimate the contract cost.
Well, and I guess I know it's already been asked, but I'm concerned, I too am concerned about the scope of the smaller project and how few kids get fluoridated versus the larger contract. And I'm concerned about being in an ongoing fight about trying to put something on the parkway that will never happen. So, that's my dilemma here is, if we invest $20,000 in continuing to look at it, are we going to get their assessment of where it would be best based on the fluoridation project, or will it also include where we're going to get the least amount of resistance and pushback?
Mm-hmm.
So if you're asking in general, I would say, and they're here to make that decision. Again, because the original study that was funded called for 3 different sites: buying a house, funding it at Carmichael Water District, or putting in the park. For all practical purposes, only the parkway was considered, but that particular site was never chosen. It gave us vague ideas about where to do it, but it didn't really specifically detail where in the park to do it. This particular study would detail that information. If you continued it, from my perspective, not dismissing any of your concerns, having that at least on the table gives us an idea of where that's going to be. Is it going to be in the 500-year floodplain? Or is it going to be in a 100-year floodplain? How large is it going to be? What the cost estimate would be? And it would also provide time. And then I think that delay would say, let's look seriously at providing the funds for the Rancho and defer for the time being anything to do with Arden. If that information is brought back and we say go ahead with the Rancho, then we go ahead with the Rancho and you vote again. If it's brought back and you don't, then I would make the recommendation to go with the Arden. But I think because of the 45,000, because of the larger number of kids served, I think it's worth pursuing this additional information.
Commissioner Gordon?
I'm sympathetic to Dr. Jones' desire to at least give this one more try before we agree to the smaller project and take a shot at serving more children. But I just want to ask Julie, if we do give it another shot with a study and so on, the circumstances you described seem to have us up against the whole wall of resistance, but are there advocates that could come forward or would come forward, or that we could encourage to come forward to tell the other side of the story, so there was at least some chance that there would be a way to sell this if we had a good case based on the new study.
Yes, I think we could bring in our supporters who could talk about the benefits of community water fluoridation. We could bring in scientists who could probably talk about chemicals in I keep wanting to say causeway, sorry, in the parkway. I think that we could, definitely. And there is a mandate in California that if there's an opportunity to fluoridate and there's more than 10,000 connections that actually, and there's money to do it, First Five is providing the money to do it, that there really isn't an option that they have to fluoridate. But that doesn't, I don't know how that really connects to building in the parkway, because that's something I think that's above and beyond just you have to fluoridate because we have money. But so if Arden were big enough, then we would say they'd have to fluoridate, and we have everything in place and can just build and turn the switch. But I think it's a little bit different just because of that.
Commissioner Elliott?
I want to add one thing that is a little bit bothering me that no one's really said. I mean, if you look at historical flooding in California, it isn't just this one area that's a floodplain. I mean, all of Sacramento is a floodplain, arguably, and if you look at the sustainability of our levees and the water systems, not just on the American River, but throughout Sacramento County, I mean, I think that there is a significant risk here for flooding, and the funding that goes into levees and protecting neighborhoods is low at best, and I think that that's a huge risk that we need to talk about here as well. If we're going to spend additional money examining this, they need to examine that feasibility, the sustainability of the waterways around this facility as part of the study in finding a location. I understand that only a week's worth of fluoride would be stored in this facility, but you have people on the other side of this conversation that truly, honestly believe that this is going to poison their children, and I'm not saying I agree with that at all. My children get fluoride directly on their teeth every time they go to the dentist every 6 months. But I don't want to discount the parents and families that have that significant fear. And I think that if we're going to spend additional money and study this, we have to really look at how flooding could impact this location. What do the levees look like? And I think that adds money. So we're coming up to a lot of obstacles and barriers, in my opinion. And kicking the can down the road isn't necessarily a bad thing if we're going to make a good decision at the end of the day. But we're talking about a lot of outside circumstances. And I think that flooding is something that, if it's in the parkway, in a flood zone, that makes me very uncomfortable.
Commissioner Porter?
A couple of things. I am concerned also, I've listened to everything everybody said, and I am concerned with the 1.8 and it being 48% to fund a very small area. But I'm also concerned with the request for an additional study, because I don't know what it will get us as far as moving forward. It will find a location. However, what I'm hearing is that there are significant obstacles, even if you were to find a location of moving forward. So it seems we would be in the same place paying additional money for a study where we are in the same place that we are right now. Unless the study could also outline the probability of actually moving forward and how long it would take to do that, I don't know what moving it down 6 months is going to give us. I really don't.
And Commissioner Jones?
So again, from my standpoint, I appreciate that. First of all, we know that it's in a floodplain. So we're guaranteed that it will be a 100-year floodplain, meaning a flood will likely happen, possibly happen in 100 years, or it will be in a 200. A flood could happen in a 200 or in a 500. So I don't think we need to do another study that says how likely is a flood? We know it. So I just want to make sure that's it. That's not, in my mind, necessary. I think the question to me would be, if we go to the 20,000, that's strictly to say, where in the parkway should this place? Should it be in the 200? Should it be in the 500? Should it be in the 100? So that's the 20,000. But I thought the second part, which I alluded to, was that during that 6 months, staff, myself, others, would then go about determining some of the feedback associated with the, say, the Park Commission. I don't know all the commissions. We've talked about the number of them. The Park Commission, presenting that to them, making some sort of understanding of what that looks like, talking to the environmentalists, making sure we openly bring this, and then have that discussion. Bring that all back. From my standpoint, bring it back.
Commissioner Elliott?
I'll just clarify, I guess I wasn't clear. The floodplains are based on 100, 200, I understand the flooding, but I mean, if you can recall, we haven't had a major catastrophic flood in quite some time. And my point was the funding that goes into making sure that levees are sustainable and can protect the areas in which that they're supposed to protect. That funding has been dismal in the past 20 years. I'm just saying that if we're going to examine where these will be in these floodplains, I think that we should protect ourselves politically, because if something were to happen, we would be in that news article as well. I think that we need to at least say that we looked at that and that we understood the levee structure, the floodplain, all of the factors that go into the location. I'm not saying we shouldn't do an additional study. I'll support that, but I just want to protect us against any negative news that may come, that we knew where we were putting it, we examined the viability of the levees around it, and felt comfortable in that decision.
Commissioner Kennedy.
Thank you. First, I want to point out that we're at the tail end of about $3.5 billion in flood protection expenditures along our river parkways, so we are actually doing quite a bit, and we will get there. We're very close to having 500-year flood protection throughout the area. But that being said, this would, if it was to go forward and to be studied and analyzed, whether or not to be put on the floodplain or, more importantly, in the parkway, wouldn't this have to go through CEQA review anyway? Yes.
It does, yes.
So all of this is going to be studied regardless. I mean, all identifiable mitigating factors that would be considered. So we're not doing this on a hope and a guess. I mean, we talk about studies being done. A study would have to be done to identify most of the concerns I'm hearing up here, and that's called CEQA.
Mm-hmm.
So.
Any other comments?
So I guess, I'm going to go with, my understanding from County Council is that if I make the motion to move forward with a study from Golden State Water District to determine the location for this within the parkway, and allow staff opportunity to provide additional kind of feedback with regard to the feasibility of the, I'm trying to work with it, so I need a little help from the staff here. Little help with that would be that the feasibility of the environmental impact and the CEQA, whatever else is needed, and then bring it back to the commission by December 31st. So that's my motion. It's kind of long and complicated, but I'd like to actually have a vote if that's possible. And again, it needs a second.
So that motion would need also to extend the contract to that time period, because right now the contract's got an end date of June 30th.
Okay,
so it'd be,
so be it.
To
and
extend the
I would
contract.
decrease it to the 3.1 million.
Well, we'd also need to have, whether you decrease the overall budget for this as something you could certainly consider, but if you're going to extend this contract, you would need also to give the authority for whatever funding would be necessary for this study.
Okay.
And can I just continue to ask for clarification just on and this is a replacement or a reaction to the recommendation of staff. The recommendation of staff is to go forward with, and I'm just trying to clarify the language, that this would sort of be a replacement. Instead of acting on the proposal before us here, this would be a replacement to say, instead of doing this right now, we're going to do an extension of the contract and provide for $20,000 to have this further review with the full components of that in order to determine whether or not we're going to spend any of this money on either of these projects. Am I understanding that correct? I apologize if I'm...
Yes, I think so. And I think if you, just for example, County Council and I have talked about this, if you decide not to support what I'm moving, if somebody doesn't make a second, it's not going to be discussed. If somebody makes a second and you decide not to support it, we're back at the Arden fluoridation staff recommendation side. So you haven't lost it. You've just simply voted to decide, are we going to go ahead with this? You'll ease my conscience. I will feel like I've had your voice and your statement to the 45,000, and then we can move forward.
So is there a motion, or are we still in discussion mode here?
Yeah, I made the motion, but I would just want to feel that everybody's comfortable with it. It's kind of cumbersome. There's several parts to it, so I don't want to try to obfuscate it. I just want to allow a certain amount of an ability to provide Golden State with actually give us a location and some staff time to address some of the concerns about the political and social capital necessary to get this accomplished.
I will second the motion, and I'll just say again, on the theory that I think we need to be very, very sure that this can't be done for many more children before we spend the $1.8 million on a relatively much smaller number of children.
So I've got Commissioner Kennedy wanting to speak before we vote. Is that?
Yeah, okay. I think so. Essentially, what this motion is, it's actually much simpler than that. It's really a continuation of the contract, which we have to do, and then the direction for a feasibility study to be conducted with a price not to exceed $20,000. Is that what I'm hearing?
Yes.
I think so.
So I just didn't want to cloud it with, my previous comments notwithstanding, any CEQA and anything that's that detailed that would have to go into would take a considerably larger amount of time, but that wouldn't happen until there's already a project in place and until we knew that was the direction we're going in. This is strictly a feasibility study.
Correct.
Okay.
Commissioner Porter?
And I just wanted to, with the motion, just be clear that the contract would be, this study would be done by December 31st, 2017, and we would make a decision in January which way we're going. Is that what I'm hearing?
So can I just ask for clarification, Golden State, if we, there's moving parts here. So if, for example, I'm not sure how long it would be to actually initiate a dollar amount, if that's been determined, and then a signing of the contract, and then the completion of that contract. So I just want to confirm that they could get that back. And then the second part is staff and the available time slot to actually do the other ancillary work that I mentioned.
And I presume it would still need to come back to the commission with a recommendation and the findings, and then we need to vote on that. Correct.
Well, I'm sorry, I just want to clarify. If we're asking, I want to truncate or shorten that process by saying that you would, in some way, authorize, if you vote for this, staff to spend up to $20,000 to conduct this study, rather than decide what it is and then come back again in August, then decide that we're going to spend it. So I'd rather shorten that process and make that now, that decision. So if that's an addition to that, I would.
No, but we'd still be back here voting on which project we wanted to support in January or whenever that is.
Whatever they said, if they clarify that they could do it in that time period.
We would just need the contract to extend beyond the time that we come back to you. So if we're coming back in January, then the contract would need to be extended beyond that January date. And we typically don't have a January meeting. So we might be talking February.
And I'm really just looking for this is the end when we make a decision.
Right, right. So, So perhaps we're looking at an 8 or a 9 month extension. We could still go with the 6 month and come back in December, but the 6 month extension really only gives us, 4.5 months, or 5.5 months at the most, because we'd have to come in the beginning of December. So perhaps you would consider an 8 or 9 month extension, with our goal to be back to you as soon as possible.
Are you interested in amending your?
Yeah, I would still like to have Golden State, Dawn White, to kind of speak to the possibility and what timeline are we talking about?
Sure. Good afternoon. We appreciate working with you all these years for this project. We're really hoping for a successful outcome. I do want to also say that the technical feasibility is not the difficult part. We build these projects all the time. All the other sites are on property that we own, so we don't have the same issue. If we could go back and explore or have an extension of a contract so we could do additional feasibility. We already have a proposal for that, so it shouldn't take that long to negotiate another contract since we've been working together for a while. We can get started on that right away, and completion within 6 months is very feasible.
All right, so.
Okay, thank you. Yeah.
Thank you.
So we have a motion and we have a second.
And so the motion just takes us through the end of December at this point?
Well, I think we don't have a January meeting, so it probably will take you to a February meeting, my understanding.
So do we need to amend the motion?
Yes, if you want, if you want it to go through what I hear is the period, I think it needs to be maybe even until March if you're the contract, so that you could have it come back in February to have a discussion about it.
So let me just clarify that one of the reasons that we're doing the extension is because we have, the basis of the contract there. If we have to go back and renegotiate a new contract, if this contract expires, that just adds more time. So continuing to be able to amend the current contract is administratively an easier process. So thank you.
Is everyone prepared to vote?
I'm not sure if that has been amended. Has the motion been amended?
Have you amended your motion?
I'd accept the recommendation of County Council as...
And it would need to be seconded.
Are you still seconding that? Yes. Okay.
March?
And so we said March as well?
Okay.
Okay.
We'll vote.
Dave Gordon?
Aye.
Beth Hassett?
Aye.
Terrence Jones?
Aye.
Olivia Kassiri?
Aye.
Terry Porter?
Aye.
Christina Elliott?
Aye.
Patrick Kennedy?
Aye.
Motion passed.
All
Thank
right.
you. Thank you very much. I appreciate the quality discussion, and I appreciate all the work the staff and everybody is doing. Thank you.
Thank you. All right, item 6.
Presentation, the first 5 oral health impacts.
This one should be a lot less painful. Dental work always, right? This is a brief PowerPoint presentation and a couple of folks to talk to us about all the very cool and exciting stuff we're doing in oral health.
Well, we'll do this again. Afternoon, commissioners, and our tech staff is doing their thing in the back. So we wanted to just share with you a little bit about what's going on in our oral health world above and beyond fluoridation. We're in partnership with multiple agencies, of course, to move forward with all the good oral health things going on in the county. Just a kind of a little history. First Five, has been involved for years with oral health. Our major focuses were fluoridation and expanding capacity, allowing better access for children, because that was one of the things that was identified by the Children's Dental Task Force, which started back in 2008, that there was a lack of access. And so that was, funding was provided for, next slide, yes. Okay, how does this work? Try that one. No. Okay, apparently I need to turn something on. Ah, that one. Okay, sorry about that. It's It's my first time doing a presentation here. So the clinic, so there were 5 dental clinics that we funded, 4 of them with WellSpace Health and 1 with Sac Native American. I did ask them briefly, how that's going, and WellSpace Health, and there are 4 clinics through so far for this current fiscal year, although they're not individual clients, they've had 46,000 visits in their children's dental clinic. That's not all 0 to 5, they serve 0 to 20. That number's been increasing every year. So Sac Native American has had some really exciting things going on with their oral health program and their expansions of their clinics. They expanded both their medical clinic and their dental clinic, and their dental clinic went from 7 chairs to 14 chairs. They're not always, so far they've got 9,000 patients just this year in 2017, and a number of about 800 kids so far. Individual children that they've been serving in the 0 to 5 population. So the other thing we've got going is the Galt construction, children's dental clinic in the Galt area. They face numerous challenges with getting that off the ground. They have a building, a contractor, and I believe July 8th or 9th, they're supposed to actually start construction there. Because this is an experienced outfit, once they've gotten to this point, they're actually anticipating that to be completed by September. So a very short, because it's a remodel, it'll be a short time frame to get that off the ground. One of the other things, of course, was the mobile dental services to provide, again, access to children. SmileKeepers Mobile Dental Services has been very effective. They go out to 450 classrooms. They reach more than 7,000 preschool children, as you're aware. And they attend multiple community events. There is a brand new dental program manager. You remember Kate Barinelli ran the program for numerous years, and she retired earlier this year in March. And Jan Ressler is the new program manager for SmileKeepers. She sends her apologies for not being able to be here today. She was not well, so she was. We talked this morning briefly. And of course, the third leg of the main focus of the funding has been the community water fluoridation, which we've talked about. And again, in the letter today, we've been committed to fluoridation for years. There's more than 800,000 residents who are now receiving fluoridated water because of our efforts and also the efforts of the City of Sacramento. And of course, the other pieces were some outreach pieces and media type things that we've been doing over the years. But it just kind of seemed for a while there that First Five was kind of waving the flag by itself. And now we're finding, because of the efforts between the Children's Dental Task Force, the Medical Dental Advisory Committee, and the community recognizing the challenges with our population with fluoridation, we now have some really wonderful partners who are involved with this. There are 3 of those groups who are here tonight, not actually groups. The Every Smile Counts program, the Early Smile Sacramento, we have the dental plans, which will come up and chat for a few minutes, and then we'll talk briefly about the Medi-Cal Dental Advisory Committee. So I'd like to have Deborah Payne, who you recognize has been so active with fluoridation for forever, to come up and talk about the Every Smile Counts program. Deborah.
Thank you, Julie. And hello to everyone. My name is Deborah Payne. I'm now with Sacramento County Public Health. And Dr. Kasiri brought me back about a year ago in order to apply for the Dental Transformation Initiative funds. For the first time, as part of the 2020 waiver, dental has been included. So we wanted to capture any money we could for Sacramento County. And I'm happy to say that Sacramento County was selected as one of 15 statewide, and it will be a $10.1 million over 3.5 years that will start July 1 and will end December 31st, 2020. I would like to introduce Robin Alonji. She's just been hired. In fact, today is her second week, beginning of the second week. She comes to us with fabulous experience and expertise. She has coordinated the CDA Cares event at Cal Expo, which many people have heard of before, I would imagine, and lots of policy experience. Robin, would you like to say something?
I am very happy to be on board. I've been in oral health for many years, been with the state, been with private foundations, and am very happy to be with the county and be able to work with all of you. And I appreciate all of the work that First Five has done over the years to support oral health.
Thank you, Robin, and I really look forward to her coming on board because she is full-time. I'm supposed to be part-time. But the most important parts of this project have been put together. Now it's time for the implementation. We proposed 3 strategies. One, the virtual dental home, and that is taking dental services to kids in the schools, in the communities where they already are. So, and then each piece of these strategies also has the care coordination. The second one is the medical dental partnership, where then we'll have medical providers on the same page recommending first tooth, first birthday, recognizing that they can also bill Medi-Cal for any oral health exams that they do and fluoride varnishes, and we want to really encourage them to do that. And the third one is, community training. We are the only GMC mandatory county in the whole state, and it takes a lot of understanding of how the system works, not only for families, but all service providers in the community. With over 100 family-serving agencies, we could add a dental component to whatever they do, whether it be focused on housing, on mental health. Still, oral health will come up at some point, and all those service providers should have an understanding how to correctly refer their families to the dental plan they're assigned to, and then to the provider as well. With these 3 projects, we are instituting a dental alert system. So if there are referral problems between our agencies, we will turn it around in 72 hours and solve whatever barrier that there is. And we also will report out at our monthly Every Smile Counts meetings so that all of the agencies can learn from how we solve the problem to make sure it doesn't get repeated. So we're really looking forward to this partnership. There's a one-pager, and anybody in the audience, if you'd like, there's a one-pager in the back. But we have so many partners. The outreach resulted in about 34 letters of support from not only Sacramento County, but also Amador County. As I mentioned before, we're the only mandatory GMC in the whole state, so we want to test these 3 strategies in Sacramento, but we'd like to also test them in Amador County. There are no Medi-Cal dental providers there except for the MACT clinic, who is at capacity currently. So we'd really like to bring the virtual dental home into Amador County and services to those children who now, if they have transportation, travel over an hour to get oral health services. I do have all the list here. We are focusing on children age 0 to 20, although we are looking at prevention and early intervention, of course. Dental disease is 100% preventable, so the earlier we get to the children and their families, the better. That's our goal. I guess I'll stop there and just ask if there are any questions. We're very happy to have school districts on board for their virtual dental home. This is a pilot, and so we'll be starting in the Twin Rivers School District with about 14 sites. And as we go forward, if there's any cost savings, we would love to be able to go into some other school districts, but that's for another year.
Commissioner Kasiri?
I don't have any question, but I did want to take the opportunity to thank Deborah for the work that she put in. As she mentioned, she is supposed to be part-time, but she has been working long hours to bring this to fruition. I also wanted to acknowledge the leadership from the First Five Commission, not only during this year, but in previous years in promoting oral health. And then also, once we knew that we were getting this funding, being very gracious in supporting the staff. I also want to thank the Board of Supervisors and the Medical Dental Advisory Committee that really pushed us because the way that the RFP was put together, it had to be a county entity to put in the application, so really pushed us to put this together. And actually the MCDAC is the one that came up with the strategies, and I do have to admit that I thought we were overambitious. Gave me a lot of sleepless nights, but very glad that we're here at the implementation stage. Very excited about Deborah and Robin, very, very capable individuals, already very knowledgeable about oral health and the layout in Sacramento County, so I'm looking forward to good things.
And I also would like to thank the First Five Sacramento Commission for the years that I was spent there and the opportunity to work on so many fabulous projects. And as you'll see on this paper, there's a lot of partners here that I worked with in the past. So it gave me the ability to know what exists out in the community, where the gaps are, and who's best able to address those gaps.
Well, it's good to see you back, and welcome, Robin. And we've got a couple of other comments or questions. Commissioner Jones?
I'll make it very quick, I promise. I just want to echo what Dr. Kasiri said, how grateful I am to have these strategies. I think, first of all, everybody working on it it's been a great partnership, as are many of the programs we've done. But these particular strategies were very interesting. They're very innovative. They were highlighted by the Little Hoover Committee, many of them, that these are the strategies you really should push. And like so many things that within First Five in the county, we're pushing the envelope. We're going outside of our comfort zone to make sure that every stone is unturned, every process is going to be looked at, and to the advantage and to the benefit of our children. And we've got great staff that can accomplish that. Thank you.
Thank you.
And Commissioner Wirtz.
Thank you. And just, Deborah, as you know, we all recognize the work you've been doing over these years to work with all the other partners and to increase our coverage on the GMC program. And we are at, according to this, around the 43% now. And I think that's great progress. It's, almost 4 times where we were when we started and so on. But of course, that's not good enough for any of us, I think. And my question is twofold. Is it likely that we're going to be able to increase that 43%, I guess, is what I'm really looking at. And are we still below the state average in terms of that coverage now?
Yes, we are below the state average, and our goal is to increase by 5% a year for the 3 years. So we've stated that to the Board of Supervisors as well. And the First Five Commission should really be proud that the progress that we've made in doubling the utilization is because of funding those children's dental clinics. There were no Medi-Cal children's dental clinics before this commission invested in that. And opening the 6th clinic will help with the numbers, as well as some partnerships with other programs that will be able to count those kids into the Medi-Cal system, because we have the dental plans at the table. And so the dental plans can contract, bring on providers, and start counting, for instance, the Smile Keepers kids, who about 8,000 a year get served, and they haven't been counted because they can't directly bill Medi-Cal. But we're going to put systems in place to try to maximize the billing to Medi-Cal. You're welcome.
All right. Thank you very much.
Thank you.
So next I'd like to invite up Rachel Cavalli to talk about the Early Smile Sacramento program.
Good afternoon, Commissioners. I am Rachel Cavalli. I am the Program Manager for Early Smiles Sacramento. We are a school-based program. I am a Sacramento County native. I've been in dentistry for 25 years. I cringe every time I say that because that gives away my age. Early Smile Sacramento is a school-based oral health program. It's run by the Center for Oral Health, and it's funded by the 3 GMC plans, Liberty Dental Plan, HealthNet, and Access. The dental plans wanted to find a way to bring oral health services to their most vulnerable members, the children. The Center for Oral Health Executive Dr. Barzaga runs a similar program down south, preschools and combined efforts with the dental plans down there. So he brought a pilot program up here to Sacramento County elementary schools. Our Early Sacramento's program goes to the schools and provides dental screenings. We do visual screenings, fluoride application, and then we also help navigate them to the Medi-Cal, Liberty HealthNet, or Access based on what we find. We use the same grading criteria, the 1, 2, and 3. We then do provide the fluoride if the parent has given us access to do that. After launching the program in June of 2016, we have 6 MOUs with 6 school districts: San Juan, Sacramento City, Robla, Twin Rivers, Elk Grove, and Gateway Charters. On our consent forms, we ask the parents to give us the permission to do the dental screening, the fluoride varnish application, as well as share the screening results with their 3 GMC plans. We have a navigator who will look them up in the portals and see if they have which plan they have, and then she provides an Excel spreadsheet to the 3 programs, the 3 GMC dental providers. And then also we provide it to the schools. In the past, the nurses were responsible for calling each one of the families and trying to help them get an appointment, transportation and translation as well. We provide that service now for them. So we have taken the burden off the school staff and the parents as well to try to navigate the GMC phone calls and such. As of June of 2017, we have screened 7,371 Sacramento County students and provided the navigation for them as well. And the school nurses do get the spreadsheets. It has greatly impacted their workload. They don't have to do the follow-up like we do. On a weekly, if not daily basis, I get phone calls from school staff with a child that fell on the playground, broke her front tooth, and we are able to get them. I pick up the phone, I call my partners, I work very closely with the 3 plans, and we get them seen within 24 hours. That's made a huge impact in the way that we deliver the service and care in the Sacramento County. We've really been able to build on that relationship with the schools and a lot of the school staff, and we're gearing up for the next school year. We've got about 15 schools already set up for September and the beginning of October to do some dental screenings. You will meet Danielle Canarazi after me. We work very closely together. We do a lot of community events. I believe we've done about 20 this year, and we continue to grow. This is our first year, a lot of trial and error, but we're looking forward to seeing 12,000 by the end of this year is my goal, and we're fastly approaching it. So thank you for your time. And I'm off to a family resource center, so I got to be there by 3. So I'm going to excuse myself. I'm going to go do some dental screenings there. Thank you.
Thank you.
Thank you, Rachel. So Danielle Canarazi is representing all of the 3 dental plans to talk a little bit about what the dental plans are doing now. Danielle.
I'm a little scared to represent all 3. No, just kidding. Hello, Commissioners. Thank you. My name is Danielle Canarazi. I am the Community Outreach Supervisor for Liberty Dental Plan. Very quickly, and just so you understand my mindset, I, like Rachel, was born and raised in Sacramento County. I'm a product of Sacramento County School Districts. And I also have a background in early childhood education. I was a preschool teacher and a toddler teacher, which made me delay having kids for good reason. I also worked at 2 local pediatric dental offices after leaving the preschool. And one of those, they worked directly with hundreds I would venture to say almost thousands of GMC families. And I joined the Liberty team a year ago in April of 2016 because they wanted somebody to be boots on the ground in Sacramento County, to find unconventional places to talk about dental and build relationships with these families, and constantly strive to educate them on how to utilize their insurance. So on a daily basis, I'm working with parents and children who are our GMC families, essentially working on a personal way to break down the barriers that we all talk about that stop families from taking their kids to the dentist. So as you know, Liberty, HealthNet, and Access are the 3 managed care plans. I apologize, I'm also a Sacramento kid that has lots of allergies, so. I do want to touch briefly on the utilization rates because that's what the conversation always turns to, and I feel rightfully so. The latest data on the DHCS website is preliminary data from 2016 that currently shows the utilization rate being 43%. That is a long way from where we came back in 2000 when I think it was at 10%, and also from 2008 when it was at 20%. And like Mr. Wirtz said, that isn't good enough. You're completely right. And that isn't good enough for us too. So I want to make sure that that is a known fact. We want to see it higher because that correlates to, we want to see these children in the dentist. We want to see these families in the dentist's office. I do want to make it known that we're making progress and we'll continue to do so because we want to go above and beyond. We want to make sure that these families get into consistent care. And consistent is a word that I really want to press there. Access to care is not an issue like it once was. And if any of you know Kathy Levering, you know that this was a big thing for her, the executive director for the Sacramento District Dental Society. For her to have said at our last MCDAC meeting, that access to care is no longer an issue and no longer the barrier was really relieving for me to hear because that's a huge thing. We, the dental plans, are responsible for building and growing our provider networks, and this includes specialty networks that doesn't really exist in the fee-for-service model. To put this into perspective, Liberty's members ages 0 to 20, there are currently 648 points of access in 69 offices in Sacramento County. My favorite example of this is something that speaks to this commission. Many children have cavities, but they're fearful and they're not cooperative, and rightfully so. I'm a grown adult and I'm fearful and not cooperative sometimes at the dentist. So the dental home offices are busy places with full schedules, and as much as they want to be able to take the time and slowly guide and soothe a child through a dental appointment, that isn't always a realistic option, unfortunately. So these children can and do get referrals to pediatric specialty offices to get their cavities taken care of in a setting that is more geared to slowing down that pace and teaching the children to trust the dental office and trust the staff. So, and to teach them to get them through those appointments at their general offices. So sadly, we do see extensive decay combined with extreme fear that quite a few children cannot be treated normally, even with all the soothing and patience that the office can give them. So luckily, we have specialty offices that offer in-office sedation with anesthesiologists in order to give these children what I call, and what I saw at the office I worked at, a clean slate. After that, it is 6-month checkup and cleanings, and the way I explained that to the parents was, it's just maintenance after this. And you change your home routine, and you change your 6-month checkup and cleaning. You actually go to those, and it helps a lot. So I know that you have heard that there have been issues getting approval for children to go under general anesthesia, which is in regards to the fee-for-service model. Liberty has approved 98.88% of general anesthesia requests for children 0 to 7 years old. So I just hope that you recognize and understand that this is something we're working on. This is something we take very, very seriously. This program means a lot to us, and so we want to do as much as we can to help these children. So also on the topic of our provider network, we handle grievances brought to us by members as well as providers. And this is something that I'm doing as far as being out in the community on educating our members. So I'm going out and talking to them and letting them know that if you have a problem with your dental home or with your dental office, tell me, call your dental plan and tell them, we want them to have quality care. It's what they deserve. It doesn't matter if they are, just the GMC community or another community. They deserve quality care just as any of us do. So I'm letting them know we cannot fix a problem that we don't know about. So please be your advocate, be your child's advocate, and let us know what's going on so we can fix the issue with that office, because we want quality providers for these people to go to. And the last thing that I will touch on is like Rachel said, she had to go to one of the family resource centers. That has been a huge part of my community outreach. We get to work with, today she's going to the North Sacramento Family Resource Center, and I will be joining her after this, to do outreach and dental screenings right there on site. And we not only do the community events, but we're trying to be in places that these families are every single day. We're at the schools. I'm at the schools doing outreach. I have set up at back to school night. I've set up at just when school started back in September and set up a table out there just to answer any questions. And frankly, yes, I'm from Liberty. I work for Liberty, but it doesn't matter to me what dental plan you have. If you have a question, if I can help you, we are going to get that figured out and help you out there. So, and lastly, I can't only speak for Liberty on this, but I would assume for HealthNet and Access as well that, like I said, 43% is not good enough. But we are here, we're at the table. I'm here all the time. And we do want this. We want this to change. We want this to fix. And we're open to the ideas. We're open to the conversation. So I am happy to have them anytime. I welcome your questions. I might be a little scared, but I'm welcome your questions.
Commissioner Jones?
Mainly, I just want to say that, it's great to work with Rachel and Danielle. They're very enthusiastic components of oral health, and it's wonderful to have them, and they are involved. I think you can see one of the strategies we're always open to is getting outside of the traditional dental office place and going to, rather than have the patients come to us, the children come to us, go to where the children are, and that's what they're doing. That's one of the strategies we've pushed, and they're actively involved in it, and they've got great spokespeople to kind of explain it and to do it, and 7,000 in 6 months or something like that is incredible. And so I think they'll meet their goals, and it's great to have you on. And we do a lot now, a lot more cooperation and collaboration with the plans, not just because of the warmth of Danielle and Rachel, but because the plans are really interested in partnering with us. So thank you.
Thank you.
Anyone else? Well, thank you very much.
Thank you very much.
Thank you, Danielle. The other point on our, you can see that we have some very enthusiastic folks to make sure we're going forward properly and in a positive way for all our medical and dental clients. The last bullet here is the Medical Dental Advisory Committee. I'm sure we've talked about this many, many times. We're fortunate that Dr. Jones is the chair of that committee. Deborah's come back on the committee as vice chair. Dr. Kasiri is involved. We have a wonderful board that we're working at dealing with the issues. Danielle mentioned about the problem with the general anesthesia that we have. The dental plans, it's a two-part thing. Dental plans approve it, then the medical plans have to approve that. Those things that occur in hospitals and surgery centers. There still is a problem at that level, at that connection. And so one of the things that the committee is working on and formed a separate ad hoc committee just to deal with general anesthesia to see if we can't go forward with finding solutions to that. And they're working with the state and they're working with the medical plans to try to move that along and see if we can't figure out how to fix and overcome those barriers that are happening and delaying care for medical clients, both children and adults. Next slide. So you see Toothy is happy there and being involved and active, and just one of the things that so I just wanted to touch on what else First 5 is doing. We're doing a lot of targeted messaging. as Danielle mentioned about the fear factor, we still find that to be a challenge. People are afraid to go to the dentist, and so one of the things we're going to be going forward with is trying to help people understand that, not all dental offices are scary. We have our children's dental clinics and others that are very friendly, and getting that message to move forward. We're working on to some more education outreach. We have our dental website, which you'll see in a minute, and doing social media, marketing and social media. Great report back in the executive director's report with regards to both the Sugar Bites program and also the digital advertising. Well, it's not on this slide, and in the prior slide, we'll go back one. You have that banner across the bottom, which is one of our digital marketing activities, for social marketing. So let's go forward. This is just a snapshot of our dental website. All of our social marketing, and not going to flip over to that right now, but what we've got there is a great resource for families to be able to go to. And you saw in the executive director's report that we do have a nice click-through rate where people are actually going out to the dental website. Gives us an opportunity to keep that updated and to keep providing more information to families. Talked a little bit about the banner, the ads, the digital marketing, the digital ads that are designed to drive traffic to our website. So they're the banner ones like you saw earlier. We have these kind of what I would call a sidebar one, and we are trying to get the message out. Also, one of the great things we have is First Five has a very active YouTube component. We have lots of things on YouTube. If you haven't been to First Five website and clicked over to go to our YouTube site, I think you should. I think you'd find it really kind of fun. And so we do have a short video here from on our dental that the tech folks will play for us. Isn't that happy?
Yeah.
I mean, it's just like a happy thing. So, and thank Erin and her marketing folks that she works with to putting that together. So we want to, so last slide, we've got contact information there. We want to continue with our key messaging. We want to continue to work with the community partners. We've got the policy and advocacy work that we'll be doing in the future. And we just want to, it bears repeat, every tooth counts. And every smile counts, and getting to those smiles early smiles program, our Smile Keepers program, everything is geared towards trying to get that message out to families and to parents to get our children in sooner and see what we can do to help making those smiles happy all year round. Also on your packet today, I think you had our new Toothy Every Smile Counts ad flyer, and this is the one that we do in both English and Spanish, and we have these available. There's some in the back of the room also, and so that's available. Any questions?
Commissioner Elliott?
Just one quick question. For the targeted messaging that works to reduce fear and encourage visits, do you take any specific or maybe customized approaches to help parents with children with developmental disabilities? Sometimes the biggest challenge for those parents with children who might have sensitivities to touch and feel at a higher level than other children, I think would help those parents in Sacramento County bring their children to the dentist. I know a lot of parents with children that have developmental disabilities, and they don't take their children.
Right.
Because it's a huge obstacle for the kids sometimes. So
it hasn't been a focus, but I thank you for bringing it to our attention. We're in the process of working forward and on those messaging. So
Commissioner Jones?
Just in light of that, we certainly agree, because those are the kids with different disabilities that are going to be under general anesthesia. So that's a very expensive and risky way of getting basic preventive dental work done, just toothbrushing, cleanings. It adds to the cost, and yeah, there's ways to do it. We looked at it in a variety of settings, and one that the DTI does is the virtual dental home. We're modeling it in a school district, but it has also been modeled in, going to child care facilities or convalescent facilities for seniors, or to, I don't know where, taking care of disabled people as well. And, so there's a variety of access, rather than bringing them to a dental office, going to a comfort zone where they already are and providing some sort of care there. Anyway, it's a challenge, but it's a very worthy challenge to tackle.
Well, regional centers. Regional centers provide services to all people with disabilities, but they certainly have a focus on children with disabilities, and they work very closely with school districts, so Sacramento Unified, of course. So that might be a resource, actually, for you guys. Yeah.
And may I just respond to that? Regional centers are often involved in our MCDAC meetings, and very active. And their challenge is so many of their clients require general anesthesia. But they're certainly open to other avenues. It's just their message to us is, we need help. Yeah.
All right, Commissioner Cossack.
I just had a quick question on other languages and how we're promoting the availability of the clinics and or other services. How are we promoting to other languages?
Right now we do most of our promotion in Spanish, but we do have, most of the clinics often have the targeted languages. So I know most of the clinics have both Spanish and Russian. I believe a number of them have Hmong and Vietnamese. And so the clinics themselves are staffing with bilingual staff to be able to provide care there. The messaging right now is still just in, the initial messaging is into English and Spanish.
Commissioner Wirtz?
Just a quick comment. I think here's a good example of where the trauma-informed approach may be very valuable when we move to the communities. That for lots of reasons, dental, like doctors, like other institutional places, are not necessarily always what we use the term. They often may well be trauma-organized rather than healing organizations. And I think so. This notion of thinking about that, especially for our a variety of different cultural groups, some who come from other countries in which institutions have a more negative role. But throughout, in general, I think this notion of trauma-informed may well be very critical to our ability to engage families, get them to come to or join this process, and certainly to make the experience as positive for children as possible. So just the connection where these play out in the cultural diversity domain as well.
Okay, thank you.
Anyone else? All right, thank you.
Thank you.
All right, on to item 7.
Presentation of the 2016 School Readiness Assessment.
And just before we jump into the PowerPoint presentation from Mikhail Newport-Berra, I want to let you know we're shaking things up just a little bit this year. So after the PowerPoint wraps up, we have representatives from 2 of the school districts that we're going to share with you just really quickly some of their sustainability efforts that they've started like right now in preparation for the fiscal cliff in 2018. So we have, in addition to Mikhail, we have Elizabeth Cunyon from Twin Rivers Unified and Carrie Norris from River Delta. And so they'll jump up as soon as Mikhail is done.
Is my PowerPoint coming? Good afternoon. My name is Mikhail Newport-Berra. As Julie said, I'll be presenting the results of the Fall 2016 School Readiness Assessment. So I'll give a quick overview about the purpose and methods. We'll get into the specific readiness scores, and then look at some of the predictors of readiness. With this one? All right, so a quick overview of the purpose of the assessment. Just a reminder, this is actually the 5th year that we've done the school readiness assessment in the first 5 Sacramento network of districts. So the purpose is to assess kindergarten readiness within the network, and then also have a specific focus on looking at the relationship between the school readiness services funded by First 5 and school readiness. We also seek to identify other predictors of readiness, so looking at demographics, health and well-being, preschool experiences, and family support. We do like to highlight that it's not intended to be generalizable to the whole county or individual districts or schools. We're really focusing on this network of 9 districts that's served by First 5. So this does give a diagram of the network that we are assessing. So as I mentioned, there are 9 districts. So that includes Sacramento City, Twin Rivers, Elk Grove, Natomas, River Delta, Folsom Cordova, Galt, Roblet, and San Juan. So across these 9 districts, we assess 40 schools, so 89 classrooms across those schools. This year we had 1,874 kindergarten students assessed, and we received parent surveys from 1,360 parents. So we get a wealth of information from parents in addition to that child level data. So as I mentioned, our focus is really on looking at the impact of those first 5 services. So in our sample, we had a little over a third, so 35% had received at least one First 5 school readiness service. And this is comparable to what we've seen in our previous assessments. So just a quick overview of the child and family characteristics. As we'd expect, is similar to previous years. We had 38% who are English learners, most of whom were Spanish speakers. 8% identified as special needs. Average age at assessment was 5.5 years old. When we look at mother's education, so you'll see the blue bars there, we had about a quarter that had less than a high school degree, and another 32% who had a high school degree as their highest level of education. In terms of race ethnicity, we had our largest group was Latinos at 36%. For family income, in most of our school readiness studies, we focus on under $35,000 as low income, and so you see in this sample that includes 68% of kids. We also did look at another definition of a low income, which is under $50,000, because that aligns with the state preschool eligibility. So you'll see that 85% of the sample falls into that category. So just kind of to give you a sense of who we're looking at. So a quick reminder of the school readiness services that are funded by First 5, because it is very comprehensive by design. So I just want to highlight that blue box on the right. As a reminder, 35% of our sample had received at least one of these services. Many children received more than one, because the idea is that by having kind of a multifaceted approach, you can have a bigger impact. So starting from the top, you'll see early education, and that includes preschool slots and transitional summer camps in that summer before kindergarten. So 17% of the sample had received one of those services. Then getting into screenings, early identification, and referrals. So this includes dental, developmental, hearing, speech, and vision. So 33% of the sample had received at least one of those. In many cases, they received most of them, because generally when they're at one of these sites, they have kind of that comprehensive set of screenings that they receive. And then another very common service was the family support and engagement. So this includes family literacy programs, parent education, kindergarten orientation, and then more intensive services like home visits and family therapy. The final category of services is play groups. So you'll see that this is a very small percent of the sample. we had received playgroups in the 2 years before kindergarten. So I just want to specify, when we pull this service data from Persimmon, we focus on those 2 years before they enter kindergarten. At the end of the presentation, I'll be talking a little bit about a separate study we'll be doing just on playgroups, because we know we have to go back further because those are designed for the youngest children. So looking at early learning experiences, so as with previous years, we have about nearly 3/4 of the sample had preschool, licensed preschool or transitional kindergarten in the year prior to kindergarten. So this includes first 5 funded preschool, non-first 5 funded preschool. About 20% of the sample had TK or transitional kindergarten, and then a very small percentage of children had licensed family childcare in a home setting. And then you'll see the blue bars at the bottom show the summer pre-K. So we don't define those as preschool, but we just like to see kind of what percentage of kids receive that service. So now we'll get into the readiness score specifically. So just as a reminder, our 3 data sources for this assessment are the parent information form, from which we get demographics as well as kind of what happens in the home learning activities, that type of thing. We get service data from Persimmon, so we can see exactly what first 5 service they received. And then kind of our main tool is the kindergarten observation form. So this is an assessment the teacher does in the first month of kindergarten. It includes 20ness readiness skills. All of them are assessed on a scale from 1 to 4. So 1 is the lowest, meaning not yet, and then 4 is the highest, meaning proficient. So this diagram shows what we like to call the basic building blocks of readiness. So you'll see along the bottom, kind of forming that foundation, are the 2 motor skills items. So we have fine motor and gross motor skills. And then because those are only 2 items, we don't consider that a whole separate domain, although they do factor into overall score. Really the 3 domains we focus on are the blocks. So we have self-regulation, which includes things like staying focused, following rules, following directions, and then social expression, which includes things like talking about a story, expressing needs and wants, and then finally at the top we have kindergarten academics. So those are things like counting, recognizing letters, rhyming, being able to write their name. So this shows the average readiness scores by building block. So you'll see along the left the scale from 1 to 4, 1 being the lowest, 4 being the highest. Children are identified as being ready in a particular domain if they have a score of 3.25 or higher. So this shows the average scores across the whole sample. You'll see that for self-regulation, social expression, those have the highest average scores. And then as we've seen in previous years, kindergarten academics had an average of 3.06, which is the lowest of the 3. And this is another way that we look at readiness, and this is kind of a more comprehensive view that takes into account all 3 of those big domains or building blocks. So if we look across the left, that shows the definition. So first, with ready, this indicates the child is ready in all 3 building blocks. So self-regulation, social expression, and kindergarten academics. Partially ready indicates they're ready in 1 or 2 of those domains, and then not ready is they are not ready in any of those domains. This helps us get a sense of kind of looking at all those aspects of readiness. How are children doing? So you'll see the green part at the top, 35% were fully ready across all 3 areas. 37% were partially ready. So combining those, you have about 3/4 that were partially or fully ready. And then we have the 28% of kids who are not ready. So that means they're not ready in any area. So that, of course, is kind of the group of kids that we're most concerned about. And this also is similar to what we've seen in previous years. So now we get into the predictors of readiness. So as I mentioned, we collect a lot of data on these students' characteristics, what's going on in the home, what their experiences were, to try to figure out what factors are associated with higher readiness scores. So this diagram shows the factors organized into 4 categories. So we have child and family demographics, so things like being older, being a girl, being English proficient, having a higher income, those are all associated with higher readiness scores. We acknowledge that those are not things that we're going to change, but it highlights some areas that maybe these children could use more targeted services. So, maybe the English learners, we need to make sure that we're serving them because they're more likely to have lower readiness scores. We want to make sure we give them that extra boost. With preschool, having attended a licensed preschool or TK, those kids tend to be more ready. Children who are well-fed and well-rested tend to be more ready. And then finally, several parent and family factors. So when the parent has lower stress, when they've received a first 5 parent education or support service, when there's more reading at home, and then also when there are more kindergarten preparation activities, those all lead to higher readiness scores. We just want to highlight that obviously we've identified the items in bold, the preschool and the first 5 parent education support are obviously specific services, but the school readiness services also address a lot of these indirectly, right? So they target the low-income kids to help them, to give them the extra boost. They increase the number of kids who can go to preschool. They make sure that parents know about bedtime so they can be more well-rested. They promote reading at home. So there are a lot of ways that they support these things indirectly, even if it's not a specific service. So then looking at early learning experience and readiness. So what I want to point out, there was a specific interest last year in readiness levels of kids who attended a family child care home, a licensed family child care home. So we did look at that. I do want to highlight, though, you'll see in the legend there the number of students we had in each category. So TK 314, center-based preschool 810, licensed family child care home we only had 26. So we're showing the scores, but that's a very small number. And so it's likely that a few kids could really sway that score. So just to really take, these numbers with that into account. And then we had 463 with no preschool. So what we see is what we'd expect. The children who had no preschool had the lowest scores. The children with TK had highest, and then actually center-based preschool and licensed family child care home are similar. I do want to note that we did adjust for factors. So you'll say, well, the TK kids were probably older. Well, we adjusted for age. We adjusted for other factors to really try to isolate the impact of this earlier learning experience. And then I want to show, this is something we see very consistently, is this benefit of first 5 supported preschool. So just to remind everyone how beneficial this is. So you'll see in the bars on the right that consistently across all 3 domains, children who attended a first 5 supported preschool had significantly higher readiness scores than those who did not attend preschool. You'll really see the biggest boost with kinder academics, which makes sense because that's something that's really focused on in the preschool setting. We saw these benefits across all groups, including low-income kids and English learners. And I do want to note that, as I said, by design, most kids who got this preschool experience also got screenings and referrals if they needed them. So it's possible that those are also contributing to this boost that we see for the first 5 preschool kids. So a few other first 5 service benefits we saw. As I mentioned, first 5 parent education support were associated with higher readiness scores. And we saw an especially large boost for low-income kids. So that was promising. And then we also saw that participating in first 5 services had other positive outcomes. So these kids tended to read at home more frequently. They're more likely to engage in kindergarten preparation activities. They're more likely to have information about school readiness. So one thing that we like to focus on with these outcomes is they have benefits not just for that kindergarten year, but moving on throughout the academic career. So if these parents are doing more reading at home with their kids, are more engaged in their school, that's going to have benefits kind of throughout their elementary, middle, and high school years. So quick summary, as I mentioned, 35% of children were fully ready, 72% were partially or fully ready. We saw a lot of the predictors were similar compared to what we've seen in the past. So things like age, gender, family socioeconomic status, preschool attendance, child well-being. As we've also seen in the past, first 5 supported preschools are linked with higher readiness levels. Children whose parents participated in first 5 funded parent education had higher readiness scores. And then first 5 services were associated with other positive outcomes. And finally, as I mentioned before, because of the number of kids and when we look at services, we can't really do a lot with the transitional summer camps and the playgroups with this assessment data. So what we're going to be doing for the playgroups is combining or aggregating data over multiple years so we can get a bigger sample size of those kids and really focus on the impact of that service. And then for transitional summer camp, we're in the process of trying to get some more specific pre-post data for that intervention period to see what the impact is of that. All right, that completes my presentation.
Steve Wertz.
Just to say that I continue to think that the efforts around evaluation around school readiness are some of our best efforts to document the value added of First Five activities. I mean, we're beginning to build some evaluation on an ongoing basis across our programs with Birth and Beyond as well as the school readiness, and I think this is going to help us with our sustainability. I think we incorporate that into our messages more and more. So one, I just want to appreciate the work that you do to collect this, and not only the staff, but the involvement of all the school districts that this requires and their willingness to allow this kind of evaluation to go forward. So I think that's an amazing partnership right there that I hope we can continue over time as well. The other question, I just wanted to clarify, I think that if I understand right, the comparison with First Five preschool is compared to those who had no preschool, correct? Mm-hmm. And I assume those who have other sources of preschool have all of these, usually other social capital, that they're coming from higher income families and so on. Mm-hmm. So the comparison with those who don't have preschool is still inappropriate. And
right, and the intention is to say, exactly the assumption is these kids wouldn't have gotten preschool experiences otherwise, so the fact that they're getting them through First Five, this is the boost that they're getting.
Mm-hmm. Thank you.
Commissioner Jones?
Thank you for this. This is, I think, a very important part of our funding program, so I'm very happy to hear this information. I guess I had some questions about it. I wasn't sure of the school readiness budget. And then how many kids are actually served by this program?
Who received any school readiness services?
Yes, I take it.
Probably the best.
Yes, hi. Yes, our budget is about $4 million a year divided among 9 school districts, so annually.
So how many children do we see in that?
I believe that's about 3,000 children. How many did you say? I think about 3,000.
It's more than that. It's closer to like 49. I think last year it was combined all 9 school districts. It was about 4,900. Yeah.
And so in slide 3, when you talk about the 658.
Right, those are the students who were in our sample.
Strictly, yeah. Mm-hmm.
And these children are entering kindergarten. So they're no longer, per se, First Five clients, because they're now entering kindergarten.
Thank you.
And maybe just a clarification on the sample selected, how are you selecting the 40 schools and the 89 classrooms each time you?
Right, so we take the 9 districts, and then there were, within each district, there are a certain number of schools identified as targeted schools based on where the services are provided, and then we seek to get 2 classrooms in each school.
Any other questions?
I'm sorry, did you tell me the budget? What was the budget again? I'm sorry, I missed it.
It's about $4 million a year.
$4 million,
for
okay.
9 school districts.
Thank you.
All right, thank you very much.
Great,
Right.
and we'll invite Elizabeth Cunyon up from Twin Rivers.
Good afternoon, Commissioners. Thank you for this time.
It should pop up in just a minute.
It's tricky.
There you go.
There we go. My name is Elizabeth Cunyon. I am the Director of Early Childhood Education in Twin Rivers Elementary School District, and I wanted to talk to you a little bit about school readiness program components. All of the districts provide these components: developmental playgroups, preschool, parent engagement and support, comprehensive screening, early intervention, transition activities, and summer camps. We feel that early intervention and prevention is key to the success of all students in school and beyond. While we touch many children in Sacramento County, there is still a very large need for families and children birth to age 5. I'd like to introduce Carrie to talk about River Delta.
Before Carrie starts, I wanted to pass this out. She'll go in more detail about the program that is funded through, or was actually, through the community building grants. Their program's called Super Mamas. They put together a little album for us as appreciation for First Five and the commission as part of that funding. So I wanted to pass it around. You can all see all the great pictures.
So I'm Carrie Norris. I am the Director of School, First Five Director of School Readiness Coordinator. She's the coordinator. I'm the Director of First Five School Readiness. There we go. That was an awful start. Okay. River Delta is located along the Sacramento River. It's 40 miles from Clarksburg all the way to Rio Vista. It's Sacramento County, Solano County, and Yolo County. So Sacramento First Five covers Cortland, Walnut Grove, and Clarksburg. No. Cortland, Walnut Grove, and Isleton. That's the Sacramento area. So you can drive 50 minutes from here to Isleton and you're still in Sac County, and so that's where we provide services. Our hub is in Walnut Grove. That's where we have our Family Resource Center. So for our 3 little communities, over 90% of our students are on free and reduced lunch. For 2 of our schools, 1/3 of the population are migrant students. So there's definitely a need for all of these services. It's a rural community. Some of our students live on an island and have to take a ferry across to come to receive services. To receive most services, they have to go either to Galt, Lodi, or Elk Grove or Sacramento. So we try with our Family Resource Center to bring as many services as possible, car seat classes, mental health services for agencies that come out to our community, Smile Keepers. We get that started for the YMCA in Cortland and for our preschools in Isleton and Walnut Grove. I want to talk a little bit about sustainability. I know that Monine is really good about reminding us about sustainability, and anytime she sees an opportunity, she makes sure we know about it, so that way we're not going to get to the fiscal cliff and not be prepared. So one opportunity that she brought to Walnut Grove and to our First Five in River Delta is Head Start. So she set up a collaborative meeting with Denise Lee from Head Start, and Head Start was trying to decide whether they were going to leave Walnut Grove community because they were having a hard time filling their spots, or if there was a way we could collaborate together. So about a year ago, a little bit earlier than a year ago, we started conversations about whether or not they could take over our Walnut Grove preschool. So not only did they take over the Walnut Grove First Five preschool and move to our site, they actually opened 40 spots on our Walnut Grove school campus. So instead of 24, we now have 40 on the campus. And instead of having a 3-hour program, they actually made it a full-day program at the request of the parents. So the day actually matches the school day and the school calendar. So that was a fabulous partnership that we've really appreciated. For Isleton, we also have a preschool, First Five preschool in Isleton, and we have another year of the grant, but knew that that was something to also talk about figuring out what to do. So we'd been in discussions with Head Start about whether or not that was a possibility, and they were kind of looking at their federal budget and not being able to really commit to that yet. So Monine again passed on the email about the next opportunity for the state preschool grant. It seems to always come during a vacation, so this one was going to be written over spring break. We had passed on a previous one that was going to be written over Christmas because I would have been the only one working on it because everyone else was on vacation. So Heather Goss, our coordinator, and Antonia Slagle, the principal at Ileton, and our preschool teacher, Suzanne Klein, got together over 2 weeks pretty much and wrote the grant for the state preschool grant to bring a state preschool program to Ileton. They requested full day, full year for 24 slots, and we found out last week that we received $258,000 for that, and we'll be able to start that in the fall. So that's some of the efforts we've made in sustainability. And like I said, I don't want to wait to the end and figure out what I'm going to do now that there's no services for our kids. So we've transitioned last year to Head Start, and this fall will be to state preschool, so we can continue all of the services for our students. Just a brief comments on our community grants. That has been amazing for our parents to be able to just come up with leadership roles and come up with ideas that they want for the community. We had a Super Mamas group, which is the little book that's going around there, and they've done all sorts of nutrition and cooking and craft classes for the families 0 to 5 age. They had Chef Verger from 1022 volunteer his time to do a cooking class with the students. So we had the little ones cooking with their parents. They promoted or helped facilitate a Donuts for Dad activity where we had over 50 dads and families come out for that activity, but they didn't want to just give them a donut and have them walk their kids to class. They thought they needed to have an activity for them to do. So they got marshmallows and toothpicks, and there were structures of all shapes and sizes being built for about an hour with the dads and their kids. So it's been a fabulous opportunity for our parents to lead, and we'll be picking up that tab since that grant's over. The school site is going to continue the Super Mamas through Title I funds because we just saw the value so much. And then I know you're going to talk a little about the Los Héroes.
We actually have a second community grant awarded recently by you lovely people. It's called Los Héroes, and we saw actually the interest from the dads in our community to be involved, and maybe a little jealous about the other group that's called the Super Mamás. And so I helped a group of dads write the grant for Los Héroes. That's 3 dad leaders who are bilingual in Spanish and English, because we have a lot of Spanish-speaking people in our community. And they are super pumped about it. They have already done a planting activity, inviting the whole school, especially 0 to 5, to participate in planting plants in the garden at the school. There's 10 garden beds, and they really loved that. And I know that they plan soccer day to bring the families out for something like that. Obviously lots of different sports since they're dads, but they're very excited to get the group going.
So now we have competing groups in Ileton and Bates and Cortland saying, okay, how do we get this going, as parents to get this going? So it's really bolstered some excitement from the parents on what they can bring to their town. So just want to thank you all, because the funds that First Five is providing, especially in River Delta where it is so rural, is really making a huge impact on our families. So I'll turn it over to Twin Rivers.
Thank you. Great things are happening in Twin Rivers Unified School District, and our partnership with First Five helps make that happen every single day. And we are so appreciative of all of the support and the partnership that we have with First Five. A little bit about Twin Rivers School District. We are the 29th largest school district in the state of California. We cover 120 square miles in, thank you, 120 square miles in Sacramento County, and we are currently at 85% free and reduced lunch. In the past, we were designated as a low API or Academic Performance Index school district. The current measure, California School Dashboard, currently indicates that we are a low average achievement for all K-12 students, and that's versus an above or below average school district. We, as a district, serve approximately 31,000 students, which includes 1,000 preschool students, plus our 0 to 3 playgroups. We represent 46 languages, 27% English language learners in our district. For sustainability, we also have CSPP and CCTR, which are funding sources from the state for preschool as well as birth to 3. We also partner with Head Start and also First 5. We receive very little funding from our district general fund. It's approximately $10,000 a year. So again, very little. The majority of our funding comes from the state of California CSPP, then our CCTR, Head Start, and then First 5. We have established an early learning task force in Twin Rivers to work on our strategic plan for early learning, birth through age 8, for the next 5 years. We are working on that right now, and we hope to have a document ready for publication early in the fall. We did receive expansion preschool slots from CSPP state, and we are opening 7 new classrooms for 2017-2018. The biggest challenge there has been finding locations that are suitable for licensing and serving our preschool students. We are currently also participating in the QRIS, Quality Rating Improvement System. We have averaged a Tier 4 rating in the program out of a 5-tier system, and that is bringing in additional funds that we have been using to ensure high-quality education for our students. We are using those funds to provide high-quality professional development for our teaching staff. With those funds, we've also been able to now offer training opportunities for our paraeducator or our teacher assistants. We, as a district, have also been participating in the Superintendent's Early Learning Committee, the Sacramento County Office of Education, and we are improving data outcomes through Persimmon. We have decided to pilot the pre- and post-evaluation for ASR during the 5-week summer kinder camp program or transitional camp program. And over the last 2 years, we've provided some piloting for the ASR data system for Persimmon. It has been challenging at best, but we are sticking to it and paving the way for those who come behind us, because I know that it will make everyone's lives much easier with the Persimmon data system and make it more accurate. We are building community partnerships with a number of partners, some of whom have mentioned us today. We are partnering with Reducing African American Deaths, Smile Keepers, a number of the FRCs in the region, Birth and Beyond. We have become or are becoming a trauma-informed organization. That is an ongoing task that we will be pursuing over the next couple of years as well. We are also participating in the Choice Neighborhoods Initiative with Twin Rivers Housing and collaborating with Roberts Family Development Center to serve the preschool students. Again, I want to say thank you to First 5. We are grateful to the Commission for their support over the years and for providing the infrastructure to carry out and expand our services to low-income families. My understanding is that when we started several years ago, First 5 was the only funding that we were receiving to provide services to these students, and now we have surpassed the First 5 funding with our partners in various areas. Without your support, we would not be able to offer many of the services that we now provide, which include take-home book backpacks that we provide to all of our families on a weekly basis. They have books in English and Spanish. We're working on getting books in other languages. And they also come with an activity card for families to do some activities in their home that go along with the book. So if there is a book backpack that has science and exploring the stars, then there may be some experiments or activities that go along with going outside with your child and looking up at the night sky and talking about what do you see, and maybe even some art activities or other things and ideas that families can do at no or cost or very low cost to the family, because again, we are serving our neediest families, very low and low income families. We also would not be able to provide the dental, hearing, vision screenings, again, Smile Keepers and Early Smiles, developmental and behavior screenings such as ASQ and the ASQ SE. Family and Community Liaison is funded solely out of our First Five budget, and that particular position reaches out and works with our families and partners with the Family Resource Centers to provide ongoing training throughout the school year. We provide parenting classes. We also provide parent, child, and teacher support for children experiencing behavior difficulties at home and at school. We have a behavior intervention assistant and a behavior analyst who are available to go into classrooms, work with children, work with the teaching staff, and also work with the families and what they can do to best support their child and help them to be successful in school, at home, and in the future. And last but not least, our 0 to 3 playgroups. Without First Five funding, we would not be able to provide our 0 to 3 playgroups to our youngest learners.
Any questions for River Delta or Twin Rivers?
Excellent. Thank you.
Thank you.
All right, is that it for that item then? Okay, item 8.
Evaluation Committee update.
We're lucky to be able to say that we had the special meeting that we reported on the last time, and we have not met during this cycle, so no report.
All right, item 9 is commission member comments. I'll just comment that I attended the Meadowview Family Resource Center Family Fun Day at Rosa Parks Middle School on Saturday, and they had a great program with music and dancing and lots of free, delicious smelling food, and had a great turnout, I think, in part just because it was such a fun event, and also it was right next to a whole lot of soccer games going on, so a lot of families were exposed to some great community partners, and I think fun was had by all. Any other comments from other commissioners? All right, then we will see everybody in August. We're taking July off, and we will close this meeting at 3:33.